bonjour de magaduk, Nigon way with them addition of cost, Namagoshin dodem, Nimen wendam Omayan, Ganabach, Nibin, Agujing, Anishinaabe, and Daobungi, Peguis, and Donchi. It's a pleasure to be here. My name is Nigon Sinclair, and I'm a professor at the University of Manitoba. I'm also Anishinaabe from St. Peter's Indian Settlement, also known as Peguis First Nation, and I'm also a columnist with the Winnipeg Free Press. And it's a pleasure to be here. It's a pleasure to do this work today, to be able to come to you all the way from Treaty 1 territory here in Manitowoc, Winnipeg, where we can very much see some of the promise of this place or the future of this place. This is the place in which life has always come from, and the center. And so Manitowoc is this beautiful place in which we recognize the land, and we recognize the water, the power of the water, and that's the theme really of today, is to think about life and some of the challenges that we faced over the past 3 months. Many of us have been hit with this ongoing feelings of emotions and concern, and particularly issues of wondering what will happen next. And that's in many ways what this panel is all about. This panel is brought to you by this online conference is brought to you by the COVID-19 Social Impact Network as well, which is a conglomeration and alliance of several different bodies, namely the Association of Canadian Studies, the Vanier Institute of the Family, Canadian Commission of UNESCO, SSHRC, several other partners as well, including those from the University of Manitoba, where I work as well. And so we want to recognize all of them for bringing us all together today, and we want to recognize them for coming together for this very important discussion. Today we're going to be talking about the impact of COVID-19 on our communities, Indigenous communities, as well as talking about the ways in which data and analysis of that data can help us to address those things in which we can imagine a better way to deal with this pandemic going forward into the future. And particularly, this time is very a reminder of how important it is to dedicate ourselves to working together into the future, and but also understanding that our communities come from a history. And so in a term what's often called a syndemic, we know that our communities, we know that Indigenous communities have had long-standing health challenges, often coming from a history of colonialism and a history of oppression on our communities, and that those things are exponentially increased because our communities are disproportionately affected by epidemics, pandemics throughout history. But at the same time, our communities are fully aware and understanding of how to handle epidemics, as we have been doing for thousands of years. In fact, our creation stories, many of our creation stories are about how we dealt with pandemics and epidemics. And so that's what a lot of those things are going to be brought up today in conversation between two very interesting and exciting panels. But to kick us off today, we have the Honorable Mark Miller, who's joining us all the way from I understand I think he's home or maybe in Ottawa. I'm not sure whereabouts you're speaking from, Minister Miller, but I'll tell you a little bit about Minister Miller. He's not only a practicing lawyer, but he's worked in several different areas, including serving as an infantry soldier in the Canadian Armed Forces. One of the things that most brought Minister Miller to my attention is, of course, when he delivered a statement in the House of Commons entirely in Mohawk. One of the very first times Indigenous languages were spoken in the House of Commons since Confederation. And I think that's a really important recognition. But Minister Miller has not only worked on that, he's also worked on things like federal investments in affordable housing and public transit and the Canadian Child Benefit. And he's also a graduate of the Université de Montréal. And so, of course, he's a member of Parliament for Ville-Marie-le-Sud-Ouest, Île-de-Sur in Montreal. And he's the Minister for Indigenous Services. So, Minister Miller, would you like to take it away and offer some opening remarks?
Thank you, everyone. And many thanks, Nigon, for the introduction. And the kind words. This is an important conference, and I'm truly touched to be asked to speak, albeit briefly. Tansi Ani, bonjour, good morning, and bonjour. I'd like to acknowledge before I begin that I join you from the traditional territory of the Kanien'kehá:ka, and I acknowledge the traditional territories in which all of you are participating here today, albeit remotely. And thank you for this great opportunity to speak. I want to thank Professors Ladner and Wilkinson, along with other members of the organizing committee, for welcoming me and putting us together for this important conference. First, I think it's the top of people's minds, and it'll be a big topic of conversation today. I want to give you an update on the progress we continue to see in flattening the COVID-19 curve in Indigenous communities. As of June 19th, we have confirmed 271 cases of COVID-19 on First Nations reserves across Canada. Of those, 214 considered recovered, and I'm pleased to report again that there are no new cases in Nunavik, where all of the previously reported 16 cases have recovered. Permettez-moi d'abord de faire une courte mise à jour sur les progrès observés dans l'aplatissement de la courbe dans les communautés autochtones du Canada. Au 18 juin, en date du 18 juin, nous avions confirmé 271 cas de COVID-19 dans les réserves des Premières Nations. Parmi ceux-ci, 214 ont retrouvé la santé. Je suis heureux d'annoncer de plus qu'il n'y a pas eu de nouveaux cas au Nunavik, où les 16 cas qui étaient rapportés se sont rétablis. Our country and across the world, we all face a monumental challenge. A predatory pandemic, COVID-19, has upended our daily lives, and with its spread has come great challenges and great anxiety and fear. For First Nations, Inuit, and Métis, individuals, families, and communities, that threat magnified several-fold for reasons everyone knows. It's been out of necessity, and because we've taken an approach grounded in evidence, that Canada has been and continues to be focused on mitigating risks and addressing the specific unique needs of Indigenous communities in the face of COVID-19. We recognize, and it must be recognized, that the unacceptable disparity across the social determinants of health contribute to the probability and severity of outbreaks, even second waves and third waves in Indigenous communities. We recognize that we need to look with a social, economic, and cultural lens to provide proper supports, and foremost, to keep people safe and healthy. Indigenous peoples in Canada experience higher rates of overcrowding in housing and a higher burden of chronic disease than non-Indigenous peoples. This is unacceptable. Some live in remote and isolated parts of the country. Lack of opportunity, lack of resources compound longstanding issues that are the legacy of colonialism. Our approach is focused on supporting people and programs, and much of our support is focused on in the form of direct transfers to Indigenous leadership so that they can determine what they need to do to support their communities in their fight against COVID. We've supported with public health efforts, with food security, with post-secondary education supports, with supports for businesses, but we do know that much more will be needed, and we recognize that communities may want and may need to reopen at a different pace than provinces and territories, and we want to support them in making that determination. The success of the efforts to date are because of the strong leadership communities have shown. Yes, there have been some 271 cases, but what we've seen is excellent work in activating pandemic plans, adapting community spaces for isolation and testing, quick action on comprehensive contact tracing, and leadership in taking decisive action to protect community members. A good example of this is the collective effort between First Nations, Métis, municipal, provincial, and federal partners when they coordinated the response to the outbreak of COVID-19 in northwestern Saskatchewan. We announced $2.3 million in funding for the Northwest Saskatchewan Pandemic Response Plan, through which Meadow Lake Tribal Council and Métis Nation Saskatchewan have undertaken really exemplary collaboration in leading the response to this significant outbreak and per capita, the most important one in the country. Their good work must continue to prevent, respond, and stop the spread of the new potential outbreak. And it can be done, as has been demonstrated in La Loche. I know I will never truly know the challenges First Nations, Inuit, and Métis communities face, but what I do know is that those communities have showed incredible leadership in their actions, and in the end, that action has saved lives. I join you today to hear your concerns, to address urgent and enduring issues to work with you to help keep communities, your communities, to keep people safe. I've heard great stories of resilience among First Nations, Inuit, and Métis during this crisis, of decisive actions that have helped stop the spread of COVID-19. These measures have worked because people have pulled together to make them work. And as Nikan highlighted, have had experience in the past and have dealt with it in an exemplary fashion. I want you to know that Canada has continued to working with you. To date, the Government of Canada has made roughly $1.5 billion of distinctions-based funding available to Indigenous peoples in support to their efforts to successfully battle COVID-19. We've announced a series of measures and funding to support public health for Indigenous peoples to help weather the pandemic. We created, at the outset, a $305 million distinctions-based Indigenous Community Support Fund. Of this amount, $215 million was dedicated to First Nations, $45 million to Inuit, and $30 million to Métis Nation communities, plus a $15 million amount in proposal-based funding for First Nations off-reserve and urban Indigenous organizations and communities. Knowing the lack of funding for urban Indigenous communities led to an additional $75 million that was also then committed to organizations supporting First Nations individuals living off reserve and Inuit and Métis living in urban areas. In addition, Canada also dedicated $10 million in funding for emergency family violence prevention shelters on reserve and in the Yukon. Furthermore, over $280 million to support the health response in First Nations and Inuit communities was announced a couple weeks ago. This is essential funding that will help provide First Nations and Inuit communities with additional healthcare providers, personal protective equipment, health infrastructure, specifically retooling of existing community spaces, and or acquiring mobile structures to support a number of initiatives, including isolation, screening, and accommodations, and community level infection prevention and control measures. As part of the COVID-19 response, we are also providing $270 million in funding to supplement the on-reserve income assistance program to help ensure families and individuals are able to meet essential living expenses. In addition, we've also announced for students $75.2 million in distinctions-based investments to support First Nations, Inuit, and Métis Nation post-secondary and recent graduates impacted by the pandemic, and $440 million in funding to support Indigenous businesses and the Indigenous tourism industry in response to the hardships created by the pandemic. Je sais pertinemment que le financement n'effacera pas les traumatismes causés par des générations de négligence, mais cela peut signifier que les peuples autochtones ont un meilleur accès des soins de santé adéquats et de l'équipement de protection individuelle. Cela peut aussi signifier qu'une entreprise autochtone n'aura pas à fermer ses portes à cause de la pandémie. Cela peut aussi signifier que de meilleurs services de bien-être mental seront là à l'appui. Ce financement permet de fournir un peu de stabilité en période d'incertitude profonde. Les collectivités des Premières Nations, Inuit et Métis sont résilientes. Le Canada continuera de les soutenir pour s'assurer qu'ils continuent d'avoir accès aux services et à l'équipement essentiel. Aucune communauté ne sera laissée pour compte. C'est une promesse. Nous sommes ici pour mobiliser les équipements nécessaires, lutter contre les inégalités et les vulnérabilités systémiques des communautés autochtones et reconnaître que nous ne pouvons pas le faire qu'en étroite collaboration avec les leaders autochtones de tout le pays. Je tiens à vous remercier tous encore une fois de m'avoir accueilli virtuellement, bien évidemment, aujourd'hui. Maintenant, je veux avoir de vos nouvelles. La voie de la réconciliation passe évidemment par la coopération, la compréhension et l'écoute. Cette compréhension, évidemment, comme je l'ai souligné, doit être faite par l'écoute. Miigwech, Nakumik, Marcy Cho, thank you, et merci.
Miigwech, Minister Miller, for that, and for starting us off in such a way to think we can think about the amount of the huge amount of commitments that I think all of us are making to be able to preserve life during this very difficult time and this stressful time. The fact is that Indigenous communities are disproportionately impacted by COVID-19 due to a long history. It didn't begin, of course, with COVID-19, but the impacts are certainly more felt because of a long history of colonialism. And when a pandemic influences, it impacts our communities, it's disproportionately affected. And we're seeing that across Turtle Island. I'm thinking of our Navajo relations down south, but I'm also thinking of our relations at the Clearwater River Dene First Nation, who are right now dealing with outbreaks within their communities, and how dealing with those have been swift, have been decisive by First Nations leaders, Métis, Inuit leaders throughout the country. And it's kind of a reminder, like during the opening days of the pandemic, I remember watching online videos by Chief Jason Henry, who's at Kettle and Stony Point First Nation, and how quickly First Nations leadership, Indigenous leaders acted. I'm thinking about David Chartrand at the Manitoba Métis Federation doing online seminars, very quickly working to provide food supports, medicine supports for Métis communities. And the closing of borders, particularly in the north by Nunavut, by the Northwest Territories, Indigenous leadership, Inuit leadership up there, Dene leadership. The kind of stuff that you're talking about, Minister Miller, in terms of the decisive action that First Nations, Inuit, and Métis leaders took early on, I think is a reminder that when Indigenous peoples express our sovereignty, when we express our rights, when we express our protection of our communities, everybody benefits. Everybody has the benefit of when First Nations, for example, in Manitoba, set up check stops. They're not just doing it for themselves, they're doing it to protect everyone around them, which involves Canadians as well. And I think that this time is a really good reminder that when Indigenous rights are recognized, everyone benefits. And that's a important indication, I think, of why the Government of Canada has done and will need to continue to support First Nations, Inuit, and Métis communities in all sectors to be able to fight and combat this sickness. We're going to move on to our first panel in just a moment here, but to understand a little bit about the impact on communities, it's not just rural First Nations communities. I think oftentimes many of the public think, oh, dealing with this has to happen, in terms of First Nations borders on reserve territories, and critically important, of course, especially if you're passing through and going, many Canadians use First Nations, for example, to support their recreational lifestyle or small rural towns, for example. Those First Nations must be thought about. But I'm thinking about particularly urban communities today, and I hope that when we talk, when our panelists speak, that we speak a lot about urban communities as well. I'm happen to be a member of the Mama Bear Clan here in Winnipeg on Treaty 1 territory. And the Mama Bear Clan has been working this entire time at the front lines. We go out 3 times a week and we deliver food and medicines to our relations in the downtown core. And what's happened in Winnipeg is the poverty has exponentially increased because of a number of factors, most notably being that businesses have closed, supports have closed, and then we also have governments, provincial and federal governments, which have cut social services and Indigenous organizations. And so more and more people are turning to the streets, and we've seen an exponential growth in what we call tent city in the downtown core. And that increase creates a situation for all of us to think about, for all of us to consider, because if just one person in a health dangerous circumstance were to get infected, as we saw this week in Winnipeg, one person in the downtown core, that sickness can travel very quickly, because how do you wash your hands? How do you social distance when you're living in a tent? And when you're living with people close to you? And for many of our relatives, approximately 80% of the downtown people experiencing homelessness are Indigenous peoples here in Winnipeg. How do we support them to make sure that we engage? Well, part of that is in the Mama Bear Clan, we distribute gloves and we distribute hands, wiping, sanitizer, sprays for sanitizer. And that's been part of the ways in which we've been able to fight this hands-on. And so So I want us to think a little bit about our urban relatives, and not just talking about our First Nations relatives, our Inuit and Métis relatives in their communities outside of the cities, but also to think a little bit about those relatives in the cities as well. I know the federal government has came on board to support urban communities as well with with funding for urban communities. There's a whole bunch of different things that are going to happen for the next two panels. They're going to be hosted by my colleague, Kira Ladner. I'll introduce you to her in just a minute. But our first panel is about data. And the question that we're asking in this particular panel is, how might data better help us understand the unequal effects of COVID-19 and ensure that we can address Indigenous capacity, preparedness, and resilience? And in Manitoba, I can think of no better place to sort of think about than some of the work that's being done with the Assembly Manitoba Chiefs and the Manitoba Health. One thing that's happened in terms of data collection is there's been a number of stresses or challenges involving privacy historically with data collection in any circumstance, but particularly when it comes to Indigenous communities, there's been an understandable resistance to allow governments to collect data for many reasons. One is that governments have most often used data against us and our communities to hurt us, to keep track, to institute certain challenges within our communities. And so there's been an understandable resistance to provide Indigenous specific data to governments, but in a very visionary decision, the Assembly of Manitoba Chiefs in the first weeks of the pandemic addressed and engaged with the officials at Manitoba Health in order to collect Indigenous specific data and then have the province collect that upon testing on testing sites, keeping track of active cases, and then also recoveries as well, and then what was done in relation to those recoveries, particularly for the purposes of things like contact tracing. And as a result, one of the things that Manitoba Health did is they handed that data to the Assembly of Manitoba Chiefs in a kind of moment of what we refer to as data sovereignty, which is that Indigenous peoples should control the data in collaboration. While Manitoba Health may collect that data, it is the Assembly of Manitoba Chiefs which are in charge of distributing it and handling it, and contacting those communities directly and making sure that there are measures in place to support them in collaboration with people, for instance, at Minister Miller's office. And so these are really important instances, but it is the only Indigenous specific data collection process in the country, unless one has happened in the past week that I'm not familiar with. Certainly what that shows evidence of is that First Nations leadership, Inuit and Métis leadership can keep track of data in an appropriate way and then handle it directly, as long as Indigenous peoples are at the center and are leading the distribution and collection of that data and how it's done. And Dr. Marcia Anderson, particularly in Manitoba, Dr. Barry Lavallee in Manitoba, Indigenous doctors in the medical health profession are remarkable leaders guiding that work. So with that, I'm going to hand it over to Kira Ladner. Now, Kira, or Dr. Ladner, I guess I'll call you Dr. Ladner, is a Canada Research Chair in the Mi'o Wet'suwet'en Indigenous Governance and Digital Sovereignties areas, and also a professor in the Department of Political Studies at the University of Manitoba. And of course, Dr. Ladner is also a former Canada Research Chair in Indigenous Politics and Governance. Just above us at Native Studies at the University of Manitoba, has a remarkable center of research supporting many students, many working communities. Dr. Ladner's research is in areas of Indigenous politics and governance, archiving, women in governance, and of course, resurgence. And one of the, I think, most remarkable contributions of Dr. Ladner is in the collection, This is an Honor Song, 20 Years Since the Blockades, which is co-edited with Leanne Simpson. And then also more recently, a collection called Surviving Canada, Indigenous People Celebrate 150 Years of Betrayal, co-authored with Myra Tate. And to list off all of your different publications, Kira, would be impossible. We won't go on too farther into that, but I know that we ran into each other the other day when you were out for a walk, and it was kind of weird for us to see each other, even though we're colleagues at the University of Manitoba. We've all been both quarantining and we've been social distancing. And so it was very nice to see you the other day face to face. And that ends up how I got on this thing, is because immediately we sort of, you asked me to join into this. And so I say huge miigwech to this and for allowing me to be a part of this panel. You're going to handle the next section here on data. And so I'll hand it over to you, Dr. Ladner.
Thank you. Let me just begin by also thanking Minister Miller for joining us today. It's actually through Mama Weepoint and my center that I was so lucky to have your chief of staff, his wife, as my postdoc this year. So I want to thank that relationship as well. Beginning this panel on data and how we better understand data and use data to help us understand the unequal effects of COVID, I am so happy to have the panelists that we have today. And I'm going to just turn it over right away with very short introductions. Valerie Gideon, Dr. Valerie Gideon is joining us. She's a member of the Mi'kmaq Nation and the community of Giskebigyug in the 6th district or 7th district of Mi'kma'ki. My apologies if I have that wrong. But Giskebigyug community is in the province of Quebec. She currently holds the position of Senior Assistant Deputy Minister for First Nations Inuit Health Branch, Indigenous Services Canada. And since joining the department in 2007, she has served as the ADM of Regional Operations, the Director of General Strategy and Strategic Policy, and as Regional Director in the Ontario region. So join me in welcoming Dr. Gideon. Thank you.
Thank you very much. And I want to start by acknowledging that I am on the traditional, unsurrendered, and beautiful Algonquin territory this morning. And thank you so much for acknowledging my home community that I miss tremendously and hope to be able to go very shortly in a few weeks. So I won't take too much of the time today, but I think I will sort of build on what the minister's comments were with respect to sort of the national approach that's been taken with respect to COVID-19. And I wanted to share that I had an opportunity to manage the Ontario region of the First Nations Inuit Health Branch. It was part of Health Canada during H1N1. And so, you know, I very much ground this experience with acknowledging the challenges of the past experience with respect to H1N1. And even during SARS, I worked at the Assembly of First Nations at the time as the Director of Health and Social Development, and also saw the challenges and the lack of inclusivity and transparency with respect to engagement with First Nations, Inuit, and Métis. So what I will do is just speak to some broad observations that I would make with respect to how things have gone over the last couple of months, but also opportunities to improve the response going forward, and also learn lessons with respect to future responses that may be required in terms of pandemics. So I think, you know, our department has done a bit of a rapid review of the international context specific to COVID-19 and Indigenous peoples, and definitely has noted in the evidence that's emerged to date that there are some common health and socioeconomic challenges, but there are also differences, significant differences with respect to the degree of inclusivity and transparency of governments in working with Indigenous peoples and nations. I don't think that there's a perfect model out there that we can point to, but there are certainly some things that we can take away about the importance of being ready and ensuring that we actually have supports available to Indigenous communities as they will require them. And I think that we have made progress in that regard since the H1N1 situation, where we had a couple of elements. So we had some funding that had been made available through Budget 2019 to be able to support, in particular, First Nations communities with respect to their pandemic plans, and also had some dedicated capacity to be able to support those efforts. So that was prior to the COVID-19 situation coming forward, and it has helped us, including the establishment of a national health emergency network that had met face-to-face actually at the beginning of 2020, where they were able to start talking about what is it that we need to quickly ramp up and do. The fact that we also had a personal protective equipment stockpile was also very important, so that we were able to quickly ensure that there were PPEs available for at least healthcare workers across First Nations communities. And we were able to step in other contexts, for instance, in some First Nations friendship centers or Indigenous friendship centers in the province of Ontario, as an example, and also in an Inuit Nunangat context where they had difficulty accessing supplies in a provincial territorial network. And that was important to have that in place and have a 24-hour standard for the assessment of those requests and be able to ship them as quickly as Canada Post could assist us in doing it. I think having clear and as simplified as possible processes for people to seek help and be able to respond quickly with funding and resources, like what the minister has noted, was also very important, so that communities knew that if they were taking measures like closing borders and so forth, that they would be able to access funding in order to be able to do that. But I think that there is definitely, the fact that Canada is very decentralized in its healthcare system presents challenges. And one of those challenges is disaggregation of data and the inconsistency of the availability of data and how it's presented. Absolutely, I agree that the Manitoba partnership with First Nations is groundbreaking. There is also data sharing happening in BC and in Ontario as well, which I would say are some best practices that are enabling leaders to, First Nations and Métis leaders, for instance, to actually track the number of cases that have tested positive regardless of where the individuals live, which is very significant. The data that our department has is specific to tested positive cases on reserve, and we do publish that information on a daily basis on the website, including the EPI curve. And although that data is limited, I will still share a few points that we do know, which is that just as of June the 17th, First Nations on reserve cases represent 0.26% of reported Canadian cases, which is lower than the percentage of the population. The recovery rate is also higher at 81% compared to the Canadian rate of 62%. The hospitalization rate is also lower at 10% versus the Canadian average of 15%. And the death rate has also been lower at 2.3% compared to the 8.3% Canadian rate. But as noted, that is not representative of all First Nations, Inuit, and Métis. This is really for First Nations on reserve. But it does give us at least a basis to be able to inform response efforts. And it speaks to the importance of data and data under Indigenous governance models so that communities and leaders are able to inform their response efforts. We have collaborated with the First Nations Information Governance Center, and I'm glad that Bonnie Healy is here, in order to support their capacity with respect to looking at improving access and quality of data for First Nations on COVID-19. And we are also working with the Strategic Alliance, which is made up of multiple First Nations, Inuit, and Métis partners, to look at how to further expand efforts for the specific collection of data across different environments where Indigenous peoples live in Canada, but definitely under First Nations, Inuit, and Métis data governance. You know, there are a couple of investments that have been made in recent years, although not specific to COVID-19, but I think that can be built upon, such as for the first time having ongoing permanent funding for the First Nations Regional Longitudinal Health Survey, funding for the Inuit Health Survey, which is also permanent and ongoing. And also there was funding in budget 2018 for the Métis Nation to develop a health data surveillance strategy as well through the Public Health Agency of Canada. And I'm not saying that those resources are enough, but they provide a foundation that did not exist previously. And there is a recognition now that First Nations, Inuit, and Métis data governance is something that needs to be invested in and needs to be supported, certainly within the context of the federal government. There are still challenges with respect to engaging provinces and territories in this type of partnership work, but I think at Indigenous Services Canada, speaking on behalf of our department, we certainly are very interested to build new and stronger partnerships in this particular area. And just to conclude, I would just note a couple of other findings to date, I would say, in terms of the COVID-19 experience overall that I do think is applicable to the area of data. You know, the importance of those pre-existing partnerships to maximize transparency, build trust, and coordinate communications and data sharing, respecting communities' decision-making authority on all levels of the COVID-19 response, the distinctions-based approach that, as the minister noted, has been applied, including to funding, recognition, of course, of the impacts of the social determinants of health, that it's not just a public health issue with a small p. The importance of having an intergovernmental plan and intergovernmental collaboration, including First Nations, Inuit, and Métis governments. So for First Nations on reserve, we have an annex that was developed in 2009 as part of the Canadian Pandemic Influenza Preparedness Guide, which outlines to some degree, roles and responsibilities of different federal agencies, as well as provinces and territories. We've updated that to have a COVID-19 specific plan relating to First Nations. But again, that effort is incomplete and would require collaboration with provincial territorial governments on a larger scale in order to more fully outline and clarify those roles and responsibilities, including a disaggregation of data. You've noted the importance of urban and off-reserve Indigenous communities and organizations. There's an assumption that can be made that there's not a governance model with respect to those communities, and we know that that's not the case. We know that there are a number of urban Indigenous communities that do have a governance approach that can be applied and is being applied in some cases to data. And then also, of course, the absence of recognition and funding for culture-based and traditional approaches in these matters. We have seen the importance of those approaches for COVID-19 pandemic responses, people going to the land for isolation, for food security, for mental wellness purposes. And the same would be true for data with respect to making that connection to culture. And also, of course, the ability to support these efforts in Indigenous languages. And I will stop there. And again, I thank you very much for the opportunity to participate in this extremely important discussion. Willallen.
Well, Valerie, thank you for your intervention here. Just to note, questions and answers should be put in the Q&A function at the bottom of your screen, and we'll get to Q&A at the end of the panel. I would like to now welcome Dr. Evan Adams to speak. Dr. Evan Adams is, of course, an actor and a doctor. He is from the Tla'amin First Nation. He serves now as the Chief Medical Officer for First Nations Health Authority. Prior to taking on this role, Dr. Adams served as the Deputy Provincial Health Officer in British Columbia. And as part of this role, he has provided independent direction on First Nations and Aboriginal health to the Minister of Health, both in British Columbia and nationally. So thank you, Dr. Adams.
Thank you very much. How are you?
Excellent.
I'm so happy. Good.
I'm so happy that you joined us.
Thank you, and I'm really happy to be here. I feel actually rather festive with Indigenous Peoples Day just around the corner. And I'm definitely remembering those who came before us today. So my job today is to talk a bit about some of the data and data lessons that we've been learning in the time of COVID. Oh, and first of all, I just want to say I'm saying hello from my own territory. I've been really lucky after 38 years to finally come back to my own territory, and I've been at home, and it's been quite a lovely experience. So in the time of COVID, some very interesting Indigenous data issues have come forward. One of the most striking at the very beginning was the demand for access to Indigenous COVID data. I got some very strong pleas from from everyday people saying, you would tell us if there was COVID nearby, wouldn't you? From chiefs who are not normally part of the public health data system, demanding that they be informed if one of their members were COVID positive. and from, say, physicians on the ground, those working in Emerge or in ICU locally, who are saying, you would tell us if you knew about a case, because you have access, I have access to public health data as a public health official, because they wanted to be able to react. After a while of being surprised, because I don't normally inform local physicians or local chiefs whenever there's a communicable disease case, but what I did realize was that they wanted to help. At least I hope they wanted to help. We were hearing rumors once in a while that some chiefs were going to use perhaps some of that communicable disease data to try and not have their members come home and be a risk. But we'll come back to that. So 271 cases in approximately 1 million Indigenous people means that in Canada, Indigenous peoples have had actually world-class outcomes. Canada as a whole has done very well compared to some of the epi cases that we've seen in other countries. In the north, there have been very few cases, Indigenous cases in Atlantic Canada, none. In Manitoba, no on-reserve cases at all. In Saskatchewan, we've had a couple of interesting discussions besides the appearance of COVID there. One was around ceremonial gatherings and how that we need to return to ceremonial gatherings, and so how would we mitigate risk if people were going to gather for ceremony, and not just for ceremony, but for cultural gatherings. So that was an interesting case in sovereignty, the right of communities to do as they see fit, including to gather for reasons of resilience or mental health, versus public health policy of social distancing, and which was going to prevail, and how could we meet together to talk about those. Saskatchewan and Alberta also had an interesting case recently where people gathered for a funeral, and there was an outbreak or a cluster of COVID cases there, which highlighted again we need to continue to be vigilant. How can we modify some of our gatherings, like funerals, so that there's less risk? And of course, the burden of that risk is mainly with the elderly, those who are, who have chronic diseases, and our knowledge keepers. So that's who we're trying to protect by asking people to socially distance. British Columbia has had a couple of interesting cases. One was an island First Nation. I think I can identify it because it's already in social media. A small island nation in northern Vancouver Island had an outbreak of over 25 cases, which they quieted down rather quickly. In fact, extremely quickly. They imposed a curfew. They controlled travel on and off the island. They pleaded with people, please stay home, even if you're not symptomatic. They pushed hard to identify places where people could self-isolate. They brought in extra personnel for contact tracing, extra health personnel to deal with those who were too sick to stay at home, and they quieted it down. 354 of First Nations or Indigenous communities in Canada closed their communities to non-essential travel. Of course, that was an act of sovereignty. They had the right. They're self-determining. They had the right to close their borders, and they did. But that was an interesting exercise for many people, in that I think some communities were not accustomed to that kind of action. We in public health talked amongst ourselves and said, do you think that would be effective for those communities? And it has proven to be very effective. And we had to consider that as a legitimate public health action to set up checkpoints and to control or ask people, what was their business leaving the community or coming into the community. I should also mention that in BC, the First Nations of BC, all 200 of them, have data sharing agreements with the province and with the federal government, and they track First Nations COVID cases in real time. In fact, they're releasing their First Nations COVID data today. So I want to switch now to the social determinants of Indigenous health, or why there's perceived increased risk for Indigenous populations. Certainly we saw during H1N1 in 2009 a greatly increased risk of infection and poor outcomes for Indigenous peoples in Canada. So we assumed that that might possibly be the case again with COVID because of reasons of poverty and income, housing, education that connoted special risk to Indigenous peoples. But there are also the social determinants of Indigenous health that culture and land and self-determination made us unique, made us different from other populations. So, of course, hopefully culture and land are protective. So for instance, in these summer months, we can go outside and collect our foods, and collecting foods might mitigate some of the economic effects of COVID. Being in the wide open space and socially distancing, you're out in your territory and people aren't near you and in your face, might be protective for COVID, absolutely. But also things that also affecting our health or where we find ourselves are things like colonialism. I call it health interrupted. Indigenous peoples were on a particular course, and then colonialism happened, and our health was interrupted, and it's still being interrupted. We're still trying to deal with those effects. And so, what exactly are those colonial effects? We spend way too much time speaking to others and trying to prove to them that this actually is a thing. Racism is alive and well. Let's not be naive. In the Canadian healthcare system, it does exist. I'm not saying it's in every single worker, but I certainly get enough complaints that people are saying they're having colonial, racist, disempowering interactions once in a while with the healthcare system. Last of all, political will is a social determinant of Indigenous health. Our politicians, our governance and structures reactive to the needs of Indigenous peoples. And thank you, Minister Miller, for being so outspoken in this area. So as far as data sharing, data sovereignty, and data governance, these are really important areas for Indigenous peoples to be really quite savvy. And there's lots of nuance within data sharing, data sovereignty, and data governance. I prefer the term data governance because it means simply asking the question, who's in charge of that? And data sovereignty, yes, of course, we should be leaders in our own data and health, but we're not the only factors. In fact, most of the time, the reason for our poor health is not our own fault. There are external forces, external structures, and an inheritance, like a social inheritance or a historical inheritance, that affect our health and well-being. We are self-determining, that is indisputable, and so we must lead the way in our own health and well-being, and that means being very clear with our partners. And I just want to end by saying, again, that we've had world-class outcomes for Indigenous peoples generally in Canada. Doesn't mean that there weren't some outbreaks and clusters in some certain communities. But generally, we've done well. And now Wave 2 is upon us, Wave 2 of preparation, because so many of our communities didn't have Wave 1 of infection. Most of our communities were not affected physically by infection, though, of course, many of them bear the brunt of stress. And in fact, the First Nations Health Authority and British Columbia are identifying that more people died from overdose than from COVID in the last 3 months. That the stress on us, the stress upon our systems has meant that a number of people have suffered and died not from infection, but from the other unintended effects of COVID being amongst us. We should also remember that we are in relationship with Canada and the provinces, though we are leaders in our own health and well-being, and I think we do need to nurture those relationships. I feel like sometimes in my work that I see a lot of antagonism between the partners instead of cooperation. And that means that there can be, if the relationship is not good, siloed or isolated action taken by individual parties. That is not ideal. An individual First Nation deciding that it is going to act alone without their partners, without, say, provincial resources or federal resources, without input from public health officials or from physicians or from the health system, and strike out alone is not ideal. Being in a relationship means then that all partners are respectful, and it means then that the province and the federal government will recognize self-determination and not confuse it with trying to enforce public health policy or things like trying to isolate individuals when they have COVID, or isolating individuals, or demanding that people not gather for reasons of social distancing and interrupting, say, a ceremony. And I think some of our governments have been very sensitive about that. That's my timer saying I'm out of time. Some of our governments have been very sensitive and good partners, and some parts of government have been kind of naive about self-determination and sovereignty of the First Nations people to do as they see fit. Thanks very much.
Thank you so much, Evan, pardon me, Dr. Adams. And thank you for mentioning that COVID is not only about, the impact of COVID is not only on physical health, but also so much an impact on stress and mental health. And there was a workshop last week or the week before last, also held by ACS and this network on mental health that I urge people to look back on. An overdose being the #1 killer in so many communities during COVID. And I think we really have to pay attention to that. So thank you for mentioning that. I'd now like to turn to and ask Bonnie Healy to speak. Bonnie Healy is the chair of the board of directors for the First Nations Governance Center, Information Governance Center. She is the health director at the Blackfoot Confederacy, or Needs Dapi. So, okay, Bonnie. Bonnie Healy is a registered nurse from Kainai, or the Blood Tribe, the Kainai Nation. She is currently Alberta First Nations Information Governance Center's operation manager. This organization was incorporated in 2010, and the organization is the Alberta Chiefs mandated organization. It represents a regional voice of Alberta First Nations, and their mandate is to uphold principles of OCAP and to do with health data and information and deal with traditional knowledge. So I look forward to your intervention and welcome, and thank you for joining us.
Thank you very much. Oki, Yudamix Kanatani, Nistoana Goka Boyaki, Nimptoto Genai, abates it to be. I want to acknowledge that I'm sitting here today from my traditional territory, Genai Nation, the Blackfoot Confederacy. One of our communities is the central point in the Blackfoot Confederacy, which comprises about, if we counted correctly, roughly around 50,000 Indigenous people, 3 communities in Canada and 1 in Montana. So I'm going to start, I think, just with trying to share my screen. So I'm hoping that this works, because I want to describe a relationship that has been ongoing for the past 7 years, from about 2013 with the Ministry of Alberta Health and their surveillance unit. And I just want to explain how we were able to quickly get to a First Nations COVID dashboard and why I thought maybe that was necessary at the early stages of when this hit everybody in the beginning of March in Alberta and Canada, where we started to quarantine and just shut down all travel, and how pulling the data was important, I think, to really help the communities understand their vulnerable population group and then how they could start planning. So just a correction, I'm no longer the executive director of the Alberta First Nations Information Governance Center, but I am currently the chair of the National Center, the First Nations Information Governance Center. I transitioned into Blackfoot Confederacy as the health director in August of last year. And my focus is really to work to developing and addressing the health inequities with the Blackfoot Confederacy nations and working with them to strengthen their primary care networks within their own systems. So, I think with that, I'm just going to focus on the First Nations population. So at the beginning of March, I pulled all of the demographic data with the Ministry of Alberta Health, and we pulled it according to zones. So not specifically to on and off reserve. I don't like to think within the fence because I know our people live and move very quickly between jurisdictions. And so trying to support the nations in having their health planning and to be ready and to strengthen communications between the urban systems and the communities which is deemed on reserve. But I don't like to think within a fence, boundaries of a fence. So we pulled all the population level data. I quickly gave that to all of the health directors within the Blackfoot Confederacy. They knew their demographics within the Calgary zone and the South zone. I also gave that to the to FNIB in the region, and they quickly shared that with all of the other nations within the province of Alberta. And we were able to do this because we started a relationship in June 2013. The province was applying for the Indian Registry to do data linkage within their ministry health surveillance system. The chiefs were circumvented in this attempt to apply for the Indian Registry, and AFNIGC was mandated to develop a health information governance agreement to oversee the application to the Indian Registry and the governance of the data system that will be housed and is housed within the Ministry of Alberta Health. So this relationship didn't start off in a good way, but eventually through the help of Willie Ermine and Dr. Reg Crowshoe, we were able to work with the ministry, with academia, to train over 1,000 individuals, both First Nations on reserve or in the community working within health systems and academia and government in OCAP training that is offered by First Nations Information Governance Center. And Dr. Reg Crowshoe taught parallel worldviews, and Willie Ermine really helped to develop the ethical space relationship that was created within this relationship. So we know the data that's available to First Nations, and some of the strongest data set on reserve data collection is the Regional Health Survey, which Dr. Val Gideon is very much familiar with, being a former chair of FNIGC. And this survey is very informative. So very quickly, FNIGC compiled a report and was given out to First Nations to look at the comorbidities that existed within the RHS in the last round of data collection of 2016. I did the same thing with the AFNIGC. I had them pull a comorbidity report for COVID and that was also given out to First Nations. I explained to chiefs and to the leadership and that the Indian Registry is not good quality data. And primarily because it doesn't have a natural relationship with vital statistics data. So it doesn't do timely updates of births and deaths. And so the administrative records or administrative data that exists within the Ministry of Alberta Health has this relationship. And we were able to, from the past, and I'll explain that, we were able to do some data linkage with the Alberta Healthcare Insurance Premium Card. The problem with this from about 1999 to 2009, when this linkage was done, it was done without the knowledge or consent of First Nations. And so data linkage within the Ministry of Health in Alberta was done without our awareness or knowledge, and had no governance system overseeing it. So when the premium stopped and the application for renewed data to update these this identifier, that's when the chiefs came in and a resolution was passed to develop the governance agreement and oversee it. And so this is what we have done prior to this, and even currently right now. When communities apply for their data, they're hostage to postal codes, and postal codes, there are not a lot of communities that have unique postal codes. A lot will share with the surrounding rural communities. And so getting a postal code level data is not the cleanest data set as well. So I just want to share a bit of a demographic pyramid to show the inadequacies of data and why we saw it as necessary to clean the data and get to the best quality data as we could. So this is a snapshot from 2016 from the Ministry of Alberta Health, showing the First Nations. So the pink are the female and the blue are the male. Pay attention to the elderly population, so the 70 to 85 plus, and then to the children. So this at the same snapshot is the Indian Registry, and it shows you why vital statistics data within the Ministry of Surveillance System was important, because the Indian Registry wasn't capturing the population group well enough to be able to get to the cleanest data set and give you the best population numbers. So this is a demographic pyramid that shows the squiggly lines are the province population group. So it just shows the larger area of where First Nations populations are larger than the mainstream. So there's the data availability and how it flows, and the data mapping is very complex. And one of the difficulties I think that we had with the COVID-19 dashboard, or getting data quickly to First Nations, is there was barriers within privacy legislation that the Alberta Health Services was not able to share things like discharge planning, or when a COVID-19 positive First Nations was not able to quarantine in their urban centers, whether it was because of pre-existing conditions like addiction and unstable housing. So this is the resolution that was passed. It is available, I believe, on the AFNIGC website. And it just is an example of the success of this relationship. And we were successful in applying for the Indian Registry for the entire country, just because the number of First Nations that live within Alberta that are not from an Alberta community is roughly around 33,000 people. So we do know the life expectancy. We have pulled a number of one-pager health trends, so we know the gaps in the data. We pulled this even before the TRC calls to action number 19 that recommends that we monitor the data within First Nations. And so we had pulled many of this type of data, like the life expectancy, infant mortality, and other things, to really identify where we were at with gap closure and what that was going to look like. So the ultimate goal was just to support First Nations in their data sovereignty and telling their own data stories. For the Blackfoot Confederacy, I've worked extensively with Dr. Leroy Littlebear and our knowledge holders. And our knowledge holders are the ones that have the transferred rights from their lifetime of being part of societies or ceremony and being taught the Blackfoot knowledge as it transferred through the generations. So I worked extensively with them since January of this year, and we were just in the middle of this work, and Dr. Leroy Littlebear helped us to develop our own cultural framework. And the goal of this group was to develop a Blackfoot Wellbeing Index. So to measure how far are we away from being Blackfoot. And the way Leroy explained it, because these meetings only occur in Blackfoot language, is how he explained it to the elders was, he referenced myself, Bonnie wants to put you back on the Blackfoot Road, and she wants to see how far you are off of that road. And she wants to measure it. And if we can go back to who we are and who we are meant to be as Blackfoot people and the life that creation intended us to live, we'll see the changes and gap closure in the Western data systems. But if we only measure from a Western worldview, we're not going to see a lot of change. The change does have to come from ourselves within, but we have to do it. The primary care networks have to be rooted in our way of life and our worldview. So just a little bit about, I want to focus more on this PowerPoint is available to you to explain the well-beings, but I want to try and get onto this dashboard because I think that's, this is the First Nations dashboard, and so it's modeled just like the Alberta dashboard, and it tells you the geospatial, where the numbers are high, and Kainai Nation right now is in the middle of a large outbreak. Unfortunately, I buried my uncle who died of COVID complications about over a week ago, and we've just buried him yesterday. And he was our first loss in our community. And if you know this individual, he is extremely isolated in the community. He was living isolation before isolation was a thing. And his only other human contact was his common law spouse. Other than that, his interactions were mostly with his cattle and his large ranching in southern Alberta. So what had happened was his stepson was positive in the Calgary zone and was not able to quarantine because of addictions and because of unstable housing. And there was concern about his grandchild and because of this instability. And so they were picked up and brought to the community, to my uncle's home. And this is where things started to occur. So one of the great teachings I think that needs to be understood by systems that are trying to support First Nations is the challenges of communicating. Because when we speak together and we talk about the inability to share information, so when the chiefs are asking, like Dr. Evan Adams, can you tell us who in the community is positive? The chiefs themselves don't want to know who that individual is, but if their health system can be informed. So in our community in the Blood Tribe, we have Dr. Esther Tailfeathers and Dr. Shay Littlebear and Dr. Susan Christensen. These are all Blackfoot doctors from our community. And they also work within the Alberta Health Services area within the Cartston Clinic. And so, having the ability to share that information or work with these physicians who are also part of the COVID task force within the community, you know, we could have maybe mitigated spread by, one, knowing which individual was struggling with quarantine if they were positive in the urban settings, and just being prepared for them when they came back into the community so that they were brought to the isolation centers that were created and supported quickly before spread occurred. And that communication did not happen. We've had many conversations since with the Calgary Zone, and privacy legislation has been put as a barrier to be able to share this information. But I still am working with them because I believe that those are excuses, and I believe we can do a lot better. So one of the things I think that I wanted to share with this dashboard that was quite alarming is the number of asymptomatic individuals. No, I have to see it, is 15.3%. Now this is fairly high. And so our community has done a campaign. In fact, the Blood Tribe is going out to every household and testing everybody within the community. And so early on, one of my recommendations to the Blood Tribe is telling them, you don't just need a membership list, you need a residency list. We need to know every individual that lives in every house. And we need to know if there are community members that are living in the Lethbridge and the Calgary area, and how often are they coming back and forth to the community. So really needing to know the flux of individuals so that we can be supportive with all of their needs and reach out to support them if they do in fact become positive. So I just want to close with some words from Dr. Leroy Littlebear. He had shared with us that in these uncertain and challenging times posed a threat of the coronavirus, the Blackfoot people will continue to draw from our traditional models of wellness and cultural values to promote strength and resiliency. So respected Blackfoot leader and educator, Professor Emeritus Leroy Littlebear, is a strong advocate for First Nations constitutional rights, justice, and self-determination, and he reminds us in these difficult times to reflect on Blackfoot values of interrelatedness, mutuality, and reciprocity, to guide our actions and prayers for others. The Blackfoot model of wellness promotes a holistic approach of well-being, whereby physical, spiritual, mental, and emotional health are interrelated and equally important. Hence, pandemic response planning in the Blackfoot context must take into account how these various aspects of health and well-being might be impacted by the threat of infection, and more importantly, how measures will be taken to address these factors in a holistic and culturally appropriate manner. Blackfoot philosophy, for example, acknowledges that people, the environment, and events are inextricably interconnected, and that the forces that shape our well-being are always in flux. This deeply held cultural belief in the interconnectedness of lives and the ever-present fluidity of circumstances is a strength that Blackfoot people are able to draw on to cope with challenging events. A shared understanding of interconnectedness means that our communities are guided by principles of collective well-being and mutual support to ensure the health of our community members, as well as those across the country and internationally. Moreover, the Blackfoot recognition of the shifting nature of lives and events, constant flux, prepares our communities well to anticipate the need to a flexible response to a rapidly changing pandemic threat. Lastly, Blackfoot communities and people have historically experienced socioeconomic disadvantages, social injustices, and health inequities, and that have greatly impacted our well-being. Yet our communities have continued to flourish and to retain our unique cultural identity in the face of these challenges. We have been able to do this by drawing on the intrinsic strength and resilience embedded in our cultural values and modeled by our elders. This strength is characterized by both the inner resilience that individuals are encouraged to cultivate to cope with personal challenges, as well as collective practices of generosity, support, and empathy for those most vulnerable in our communities. This collective strength and cultural resiliency will continue to guide our efforts to respond effectively to the coronavirus pandemic. And so with these teachings, I am part of one of our sacred societies that will be going forward and having a large gathering this summer. This exact gathering is actually why our practices went into the Criminal Code of Canada. So in the early stages of colonial visiting to our territories, a very highly elected individual was brought to watch our Sundance, and the wife had lobbied her husband to put this into the Criminal Code of Canada, that we were not allowed to do this anymore. So my concern is, and I've had talks with the province and with the federal government, is we will gather, but not to put anybody in harm's way. We are doing this for the well-being of our people, and this has never been stopped in our records of knowledge, and I'm working to try and ensure that it's done as safely as possible. Thank you.
Thank you, Bonnie. It's I want to first send my condolences to your family about the death of your uncle. That is incredibly saddened my heart. I also want to thank you for reminding us of the resiliency of our communities. I spent much time down at Kainai with the Uncle Leroy, and had some time with Reggie, and thank you for raising both of those names and raising my spirit and hopefully the spirit of others with their words and your words and what has been done. It is important to remember that resiliency of community, but also that flex and interrelation and interconnectedness, that these fences around the reserves, around Scungun, are only fences, and that there's always this has always been and will always be this movement beyond and into traditional territories and even beyond that. So paying attention to that is incredibly important when we think about data and when we think about this virus. And once again, my apologies and my condolences on the death of your uncle. I want to move to Courtney Sky. Courtney Sky is an incredible young voice. I first saw in her conjunction with the Yellowhead Institute at Ryerson. I came across some of her writings, and it has she's reminds me of how incredibly lucky and how incredibly privileged we will be to see these younger generations take wind and rise up and become those next leaders. And they already are those next leaders. So thank you for reminding me and for being part of that voice, Courtney. Courtney Sky runs Little Sisters Consulting, as well as writing with Yellowhead Institute at Ryerson. She has led policy development for the public sector at local, provincial, and national levels, with a specific focus on youth development and ending violence against Indigenous women, girls, and Two-Spirit people. Her work focuses on the promotion of political mobilization of Indigenous women, trans, non-binary, and Two-Spirit people to create transformative change in communities. And thank you for joining us, particularly since there is a power outage out of Oswego today. So thank you so much, and Sego, and the floor is yours. Thank you so much for joining us from your car.
Yes, Scana Oswego. My name's Courtney Sky, and as you said, I'm coming to you from Six Nations of the Grand River Territory, but I am definitely not on the reserve today. I've had to leave the reserve in order to get data to be able to speak with you here and stream from my car. So if you've seen me on other panels, this is what typically I stream from, but I had hoped to be able to share some information with you today. There'll be links that are shared with you through the chat function so that you're able to see some of the data and some of the work that I've done specifically addressing COVID-19. I'm here to speak to you about an article that I wrote for the Yellowhead Institute. It's called Colonialism of the Curve, Indigenous Communities and Bad COVID Data. And this brief came about based on our experiences in community, but definitely informed by my own experiences, coming from a place of advocacy for missing and murdered Indigenous women in relationship with families that are impacted by violence, and also working with young people who are experiencing criminalization through the youth criminal justice system, and also through experiences in the child welfare system. And that's where my policy work has focused for a very long time. And so from that experience, I'm well aware of some of the systemic barriers that exist to exercising jurisdiction, but also some of the systemic gaps that exist when it comes to data and information. And so while I'm new to this conversation of health, I'm definitely not new to the conversation of data and some of the issues that come with data collection. And so as I was with my community and in community, we were noticing, as COVID cases were being reported in communities, that there was a disparity between what our communities were seeing and what the federal government was reporting. And so very early on, I would say in February and March, there was a point in time where my community of Six Nations and another Mohawk territory of Kahnawake, if you added our number of cases together, you actually have the total number of federally reported cases for Indigenous COVID data. And that didn't make sense to me, and it didn't make sense to a lot of my peers. And so we began tracking what communities were reporting in comparison to the federal government. And as we collected this information that was publicly available to communities, we began to notice an increasing disparity. And so over time, we collected this information. And I think it's very important to emphasize here that we were collecting information that was available to communities. So this is information that is available to people through their bands, through social media, through their local public health information systems, and by the federal government. And so this is based on what our communities are hearing, and not necessarily what public health officials are keeping to themselves or not making publicly available. And so that is very important, because for me, when we talk about governance and we talk about jurisdiction, it's a collective jurisdiction, and we need to understand jurisdiction and governance from that community perspective, and how are all members of our community able to participate and exercise their responsibilities when it comes to the participatory nature of our governance structures. And so with colleagues at Yellowhead, and also with Emily Parker, who is a master's in public health student. She also has a master's in health promotion. She provided some advice on how to structure our database. We began collecting this information. On May 14th, we published our data, and we found that on May 12th, we published our data. And we had found 465 cases of COVID data in communities and 7 deaths. At the time, the federal government was reporting 183 cases and only 2 deaths. So we're seeing our communities are far more impacted than I think the data being available through First Nations governance is allowing our communities to understand. And as we talked today, as we've increased and monitored the number of cases, we're aware at Yellowhead of the last time we collaborated our data, so May 27th, that there were over 600 cases of Indigenous people with COVID data across Canada and 12 deaths. And as Minister Miller stated earlier, the federal government is reporting only 271 cases and 6 deaths. And so this is a really huge disparity, and it comes as a consequence of colonialism, as a consequence of the health system and how it's set up in communities. As discussed in the brief, there's a disparity between how health services are delivered. You know, we think about some of these ongoing legacies of colonialism, the division of powers between provinces. That is a consequence of the ongoing colonialism that is experienced in communities and how that has progressed over time. And so we really see the services that we receive now are directly a result of the staged kind of incremental displacement of Indigenous governance, you know, across the nation and across land. And so it's really critical that we look at, you know, the access in these contexts, and that we continue to question what kind of reality of our communities are being used to inform public health and public policy decisions. There's a distinction-based approach that is being taken to policy and program development that doesn't really accurately reflect our communities. You know, our communities, especially people living in urban settings, don't live in distinction-based silos in urban settings. Our communities are integrated with one another, and we are in relation to one another. This is especially concerning. One of the links that has been shared with you is some of the information that is available to my community through our public health agency. And so we see, for example, Six Nations, where our community has recorded 14 cases. But if you look at surrounding communities, Brantford has 120 cases, Haldwin Norfolk has over 414 cases, and Hamilton, which is very close as well, has over 700 cases. And so when we look at where our communities are situated and we recognize that communities have a housing crisis, we recognize that our family members and our kin that are not able to be housed on reserve but want to live close to their family networks are often in these rural communities. And so we don't really know at Six Nations how many of our members or how many community members are impacted. And we also know that even though our communities did set up checkpoints for a limited period of time, we did not restrict non-resident band members from coming into the community, recognizing that people live in urban settings, are coming back to communities, are coming back to reserves to support elderly family members and to bring supplies or what have you. And so there's this lack of recognition of the realities of our communities, how our communities relate to one another, how people in urban and rural settings connect to First Nations, and also how our governance of one another is different because our communities relate to each other in a different way as well. I'm a Mohawk woman, I'm a Haudenosaunee, and for us, our communities are spread across multiple different jurisdictions. Our communities are spread from Ontario into Quebec, into New York State, and we travel in between these communities for ceremony and for governance. And our communities our families want to connect, and we want to be able to connect with one another, but the specific needs of our community when it comes to being able to travel across colonial borders is really not considered in the public health data and information that's being made available to us as Haudenosaunee people and citizens. One of the opportunities that has been put forward is because Six Nations does have our own public health agency, that our local officials were much more responsive, I think, than the federal government was able to be in addressing our local community needs. And our seeing the conversation happen in BC where public health officials seemed surprised that chiefs were interested in information around data, our public health agency in the community at Six Nations proactively reached out to the hereditary governance system in March to make them aware of the incoming threat and what the potential impacts might be to us being able to carry out our ceremonial purposes. And that is a widely different experience than other people have had as well, that we hear across different territories and different peoples. So I think that there are, a number of different ways in which our community is misunderstood, or the ways that external forces try to define who we are and how we relate to one another, that don't reflect the needs and the realities of our communities. Um, the part of the findings or reflections that we had through looking at this data and this huge disparity was the fact that our communities aren't seen in their entirety. We continue to have an inability to express what it means to deliver services, and so it's pretty disheartening and frustrating, because there's also a number of different studies and reports over time that show this ongoing lack of information and the challenges that exist when communities don't have the ability to analyze and interpret information, and have that cultural competency necessary to analyze and have the ability to make informed decisions. Since publishing the report and since being engaged in this conversation, I've noticed as well and experienced a number of people making racist and stereotypical assumptions around Indigenous people and our ability to understand and interpret data, that a lot of people never considered that our communities would be interested in knowing or being able to understand data and information because of that we wouldn't understand it or know what to do with it. And I find that based on a, really racist assumption that we lack somehow the expertise, the technical ability, or the intelligence to be able to interpret and analyze our own information. And that to me is a really important myth to dispel, that there are a number of Indigenous professionals and people who are able to make these decisions, and that a perceived lack of capability does not supersede the rights of people to be included in their own decision making. There's no there's no kind of precondition that Indigenous people need to meet in order to be able to express and exercise their inherent rights as human beings, to be able to have control over the decision making and governance. And I think that's really important to consider when it comes to us reacting and trying to consider what responses to things like pandemics mean, because our communities have a right to solve our own problems, but we also have a right to exert care for one another. There's one thing I want to discuss before I'm finished. I just want to talk a little bit about the experience of people living in secure custody and people living in congregate care settings. So Nora Loretto, who's a researcher who has been, and a journalist who's been tracking the number of deaths in congregate living settings across the country. She's found, as of her research yesterday, that 83.4% of the deaths in Canada come from congregate living settings. And in this data and information, there's no real ability for people to discern people's racial identity. There's no disaggregated data available with this. And so when we see things like, the critical lack of infrastructure in communities, the lack of shelter spaces, the lack of long-term care facilities or elder care in communities, we don't know how many people are living in these congregate living settings are Indigenous. Through my research and through publication, I do know of 2 people who were living off reserve in a congregate living setting that had a COVID-19 outbreak, who passed away as a result of contracting COVID-19 in their residential facility. And because the majority of their family lived in the nearby First Nations, their funeral services and their internment happened in community. And so that risk of transmission and that experience is not really captured or understood in some of the abilities of our communities to react and respond, especially if people are passing away outside of community and choose to be buried within their home territory and their family participate in funeral services and grieving services. I also want to talk about carceral sites. So Justin Pichet is a researcher who's looking at the spread of COVID-19 in carceral sites. And that it's not clear how communities are being made aware of their members who may be in secure custody, whether or not they're contracting COVID-19 or whether or not communities are being engaged to be able to see early release for their members or have them return to communities in a justice setting to mitigate their risk of contracting COVID-19 in congruent living settings. In the brief, we discuss the experience of Joelle Beaulieu, an Ojibwe woman who contracted COVID-19 at the Joliet Women's Institute, who's filed a class action lawsuit against Correctional Services Canada, saying that it failed in their duty to protect vulnerable inmates. And so we're not sure of the rates either of at the community level of our members who are far overrepresented in the carceral system. I want to end just by reflecting on the reality that there's been almost twice the number of deaths in Indigenous communities as is being reported by the federal government. And those communities, those people are, and their families are not able to be heard and seen and supported in the way that communities would normally do to extend care. Expressing care and kindness and consideration and love is as important an exercise in jurisdiction as any other. And so when we look at how communities support one another, it's often outside of the usual systems of care that people and governments and institutions define for them. So I really want to call attention to that, and I want to acknowledge my own community. You know, the person in my community who has died, they are not known. Their name has not been released, but it is known within the community. You know, oftentimes we talk about, you know, the privacy being a huge concern, and people in the community know and recognize who the family is that has lost someone. And so through social media and community relations, people in our community have extended a tremendous amount of care to that person's spouse. Dropping off and social distancing gifts for them, you know, helping them cope, sending them self-care items, and making sure that people who are in isolation are having their needs met. And if we continue to, you know, react to systems that are
I think we have just lost.
I was just going to ask Kara, did that freezing happen for you too?
Yeah, that freezing has happened for me too.
Like,
Courtney,
probably a data issue.
I'm going to extend an apology that we can't listen to your final words, that you're frozen and it seems to be disconnecting. So we have question and answers, a Q&A going, and Q&As have been posed and actually answered by most of them. There's one here for Courtney, and I'm going to leave it for Courtney to answer when she comes back online. The other question is this webinar going to be made available to participants? This webinar will be made available to participants and will be made online on ACS's website, and we can give that detail at the end. I'm just going to leave questions for this panel to be answered online because that process is going well. If you want to see what questions have been answered or asked, please take a look at the Q&A section. And I'm just going to do it that way because we are running a bit behind. I'm going to turn it over to Nigad for a few words before we move to the next panel.
Great. Yeah. So miigwech to all panelists, and for you know, on top of advocating for data sovereignty or data governance, as Dr. Adams was pointing out, the importance of understanding the situation, of being able to analyze it fully and completely, I think is critically important. And so being able to have an accurate picture, which is Indigenous led and respecting the protocols of each community, is of critical importance for heading into this pandemic. And so, and as we enter into phase 2 or the second wave, as it were, in Winnipeg, we're just beginning, I think, a minor level of the second wave. And of course, directly, it's impacting Indigenous communities. For instance, a person in the downtown core in the people experiencing homeless community, that's particularly where this is likely the second wave is beginning. For the past 3 months, my department has been hosting online seminars, online panels. We call them our colloquium panel. Typically, we have a research series that we do throughout the entire year, and what we've done is we've converted that into a colloquium panel to discuss the impacts of the pandemic on Indigenous communities. And so we've had people from everywhere, all across Turtle Island, Las Vegas, Massachusetts, Portland, New York, people who have come and shared their information from their campus community, also from Indigenous communities that they're working with. And it's remarkable to see the kind of innovation that Indigenous communities are partaking in reaction to engaging the pandemic. So for instance, just in these parts in Treaty 1 territory, we've seen communities, for example, establishing medicine picking groups and then distributing those in the community center. We've also seen, as I mentioned before, medicine and medical equipment sharing with people in urban communities, in poverty and disenfranchised communities. And we've also seen the direct increase or the perhaps made awareness of the impact of the pandemic on Indigenous women. Particularly when the data first came out about the impact of the COVID-19 pandemic on Indigenous communities, approximately 80% of those impacted were Indigenous women. And those are grandmothers and aunties and cousins who are taking care of their family members. Those are ones working in healthcare and other frontline services, particularly in mental health, in direct service, in stores, operating storefronts, for example. And so what we can see is that there is a need for the data to help us understand what's the impact of the communities. And so that's why we started today with our panel to talk about data, because that gives us an accurate picture in order to talk about the impacts. And with impacts comes stories of resilience and stories of response. So in this next panel, in this next portion, we're going to hear from people in different elements, different communities throughout Turtle Island, throughout Indigenous communities all across this section in this northern part of Turtle Island, to be able to talk a little bit about both what is the impacts on communities, and then what are those responses that have taken place? What are those ways that communities have engaged that disease when it comes in, and what are the active ways that are best practices in order to engage it? So I hand that back to Dr. Ladner. Dr. Ladner, take it away for panel number 2.
I knew that would happen, me being on mute. My apologies. I'd like to just, now that Courtney is back online, I would like to thank Courtney, and what an amazing presentation. Thank you very much for that article, and thank you for your intervention today. Those words mean a lot, and I think that I think everyone has heard them and will hopefully hear them with more than just their minds. I also want to recognize that your being disconnected really reminds us of the vulnerability of communities outside of these metropole areas, and this inequality of connectivity that we all have to deal with. And that, so thank you for being a great reminder of that fact, and that these are things that we need to work on, that when we think about socioeconomic impacts of COVID, it's internet and inaccessibility of the internet and power is often a grave marker. I'd like to now change to panel 2, of course, and I asked the panelists that are about to speak, I called some friends, as one does in this country, to speak. And the first one that I'd like to draw on to speak has been a good friend of mine for years, the Honorable Senator Kim Pate. Kim was appointed to the Senate on November 10th, 2016. She writes in her bio that first and foremost, she is a mother of Michael and Madison, phenomenal kids. But she's nationally renowned as an advocate who has spent the last 40 years working in and around the legal and penal system of Canada on and with some of the most marginalized, victimized, criminalized, and institutionalized, particularly imprisoned youth, men, and women. And it is in this work that I got to know Kim through my auntie, our deceased friend, Trish Montour. And I wanted Kim to speak, recognizing that, you know, so many Indigenous people are incarcerated. And I think that to think about where community sits and to think about how community is being impacted, we would be amiss and we would be so saddened if we didn't hear and think about what is happening in the prisons. And I asked Kim because she has been a phenomenal advocate for prison change. And at the beginning of COVID, she was the voice that I saw every day on the news talking about what we needed to do in our prisons to make them safe for our people. So Kim, thank you for joining us. The floor is yours.
Great, thank you very much. I have to call you Dr. Ladner, but Kira is great. Yeah. And I want to dedicate what I'm going to say to the many lives, sadly, that have been lost by youth, men and women, as well as Dr. Trish Montour, who was one of our key friends, mentors, and inspirations for this work. I want to start also by acknowledging that I come to you from the unceded, unsurrendered territory of the Algonquin Anishinaabeg, a territory in which I first arrived as an uninvited guest and have had the privilege of being welcomed into since then. And so I thank you. As a non-Indigenous woman, I take my responsibilities of being entrusted and being invited to a forum like this very, very seriously. So I thank you for that. I think it goes without saying, especially to all of you, that this pandemic has revealed what most of us have known has existed in this country for decades, which is the massive inequality and the extent to which a social, economic, and health safety net that many people who have a great deal of privilege thought existed in our country actually did not. And nowhere more have we seen that, in my humble opinion, than in the institutions, on the streets, in the places where people have not been protected for many, many years. And we have seen the impact in, obviously, care homes. And as someone whose mom is currently palliative in a senior's home, the impact of that is massive in terms of what we have to do. But in our prisons, we have somehow allowed, I say somehow, I know how, we have allowed the stigma and the racism and the class bias and the gender bias and the biases of presuming that those who are there deserve somehow to be there, to cloud the fact that we have increasingly used in this country and in others, prisons as a stand-in for all of the other systems that have failed, for all of the other systems we have allowed to be basically wrenched apart. And so the people who fall through are those who have the least. And so as the pandemic started, we were in a situation where we already had more than 80% of the folks in prison were poor before they came there. I would say it's actually closer to 100%. 42% of the women in federal custody were Indigenous, 11% were Black. So more than half were already racialized. The numbers are slightly lower. The numbers of men are far higher, but the percentage is lower. We had almost all of the individuals who are in prison are dealing with past trauma and are trying to negotiate poverty, the trauma of whether it's residential school, whether it's child welfare system, both, as well as poverty and the result of lack of supports that often lead to things like self-medication or medication by medical professionals, and so addictions and mental health issues that also resolve. So increasingly our prisons were being used as a substitute, an inadequate, wholly inadequate, totally inappropriate substitute for treatment centers, homeless shelters, shelters for battered women. And so not a big surprise that when the pandemic hit, many of us were extremely concerned that we had more than one in four of the individuals in prison fit into the quote unquote vulnerable category in terms of COVID, in terms of age. Many had respiratory issues, many had pre-existing chronic health conditions. Preventable, I might say, had they not been in prison, had they not been poor when they were in the community, had they had supports. And so we saw a massive focus on clamping down within the prisons. And ironically, it was some of the provinces who took more progressive positions, even in Ontario, to look at how to stem the tide of people coming in, how to stop those who were serving interim sentences, for instance, from being in custody, trying to enhance bail programs to prevent people from being in. And many of us called immediately for the release of individuals. And I want to thank Courtney Sky for talking about the work that Justin and others have been doing as part of the criminalization CPEP project here in Ottawa. But one of the things that the response of the government was to immediately start to lock down the institutions. And in most provinces and territories, as well as the federal government, was to lock down. And so in a context where we have the clear recognition by two courts of appeal and other lower courts in this country that the use of solitary confinement or segregation is a violation of our charter, a violation of international human rights and other standards. At that same time, it became basically correctional authorities were authorized to lock down entire populations. And when you already have the class, race, and gender bias in the prisons that we had before the pandemic, that meant that it's disproportionately been those who are racialized to experience this, disproportionately those who have histories of trauma and that manifests as mental health issues, who ended up in the most isolated conditions. But by very quickly into the pandemic, everybody, including those some 110 or more who had already been granted parole or conditional release by the Parole Board of Canada, but had not been released yet, as well as individuals who were in minimum security, as well as up to 2,500 or 3,000 who were within days, weeks, or months of being released from at the end of their sentence. Those individuals were also being held in those conditions. Now, my personal opinion is nobody should be held in those conditions. Clearly, the Ontario Court of Appeal and the BC Court of Appeal agree that there should be limits on those. And then in the midst of this, although on, I'm just checking my date here, I think it was March 25th. Yes, March 25th when we were in the Senate. In a question during question period, we asked Minister Blair what the plans were, because all of the medical professionals that we were hearing from, including Jane Philpott, and she and I wrote an op-ed, a couple of op-eds about this, were recommending that the first priority in congregate settings, prisons, healthcare settings, would be to release those who had places to go in the community, who could be supported in the community. And so to reduce the numbers of individuals in those settings so they could actually practice the hygiene measures and the physical distancing that were being recommended by health authorities, and to to ensure that we didn't actually create new vectors for introducing or overloading the healthcare systems in the regions where the prisons were. And as many of you will know, the prisons are often not in large urban centers, but in small communities where an overloading of the healthcare system could be very realistic. What's interesting too is I started to receive calls from doctors and medical professionals from all across the country concerned that they were being silenced in this, that those who worked in the prisons who were extremely concerned about their prisoner patients were being advised that they should not be recommending this, and were instead being encouraged to only recommend physical health and PPE, personal protective equipment, and physical distancing. Now, the only way to do that, as I mentioned, in a prison, as you can imagine, is to basically be locked in your cells. And yet medical professionals were advising against that. And many of them were reluctant. There were a couple who came forward publicly and were willing to swear affidavits for court cases like the one that Joelle at Joliette and others have brought. But many of them were not willing to go public for fear of losing access to their contracts within the prisons or losing access to their patients, the prisoners who were in. And so it effectively silenced those who basically had the best advice. So we then, in addition to the media that Kira mentioned, we were writing op-eds, we were working on things with academics and activists throughout the country. What we also did was to write to Dr. Tam and to all the public health officers across the country for every province and territory, and indicate that and urge them that they should be doing a public health audit of all prisons within their jurisdiction. What's interesting, we had to write back to Dr. Tam. We haven't heard back from many of the public health officers yet. But we had to write back to Dr. Tam because her response was that they were working with the Correctional Service of Canada. Now, the official position of the Correctional Service of Canada was that they didn't actually need to release people. And then they advised, and the minister was quoted publicly as saying that they had released prisoners during this pandemic. And some of you will be aware of the media that then ensued there after he gave an interview with the Aboriginal Peoples Network. Oh, that's telling me to shut up. To rack up. So at any rate, it became clear that the evidence was that some people were being released, but it was the people who were at warrant expiry or who had already been directed for release by the parole board, and that in fact the rates of release were reduced, and that the reduction of numbers of prisoners was really in large part because of the reductions of prisoners coming into the prison system, not because of those being released. So that remains a whole nother area that needs to be examined. And when we talk about disaggregated data, we've been asking for the race and gender breakdown. We have some of that, but still wholly inadequate, and certainly inadequate in terms of comparisons of parole review or release rates prior to the pandemic, as well as those during the pandemic. So we await that information. We've also then been asking questions of those who have been appearing before the committees at the Senate, the Social Affairs Committee and the Finance Committee, as well as when during question period. And if you want any of that information, the details, we'd be happy to share it. Most of it is linked to the bio page on the Senate website. Those of you know me know I'm a techno-twit, so if you need the link, let me know, and if either me or Evan or Emily or one of our amazing interns who's working with us will send that information out to you. The other thing we've been working on and just came up again recently, well, just this week, when the Black Caucus released its recommendations or its calls to action, is the fact that there are provisions that are already in place. In February, we retabled Bill S-208, which is a bill to allow judges discretion to not impose mandatory minimum penalties. We retabled Bill S-214, which is a bill to allow records to expire and convictions to expire without the inordinate cost of $645 to over $1,000 to have a record to apply for a record suspension, as well as an inquiry to look into implementing a guaranteed livable income. So then the pandemic hit, and now it seems all the more clear that we need to not just rebuild, because I would argue it wasn't there in the first place, but to really construct and put in place the types of plans that our colleague Senator Sinclair, the Missing and Murdered Indigenous Women Inquiry, the calls to action and calls for justice respectively, recommended a whole action plan of what we need to do to address these issues, including a guaranteed livable income, including getting rid of mandatory minimum penalties, including providing ways to get people into the community. So I'm actually quite hopeful that this moment could lead to some very different results, and that we could be looking at the kinds of non-carceral decarceration activities that many of us have been involved with for many years, and that the extraordinary approaches that need to be taken can happen. We already have the provisions in the corrections legislation and in the criminal code to allow for individuals to be first and foremost in the community, and we need to be pushing for those, whether that's the section 718(2)(e) of the criminal code, whether it's extraordinary remedy of getting people out under the Royal Prerogative of Mercy, section 748, or whether it's using the provisions of the Corrections and Conditional Release Act, section 29, which allows people with mental health issues to be moved into community-based mental health settings, or sections 80, 81, and 84, which are particular to Indigenous prisoners, and which the Senate last year, during the debate on the during the consideration of bill that changed segregation to structured intervention units, recommended be expanded to include other prisoners who are disproportionately subject to segregation, such as Black prisoners, trans prisoners, and basically to allow greater access to get people out. Those provisions have not been fully implemented. There are opportunities to do that, and I think the calls for defunding and decarceration will allow us to move in those directions. I look forward to some of the discussion, and if there are areas that people would like more information, I would be happy to share that. And just a final is, many people celebrated when the government decided not to continue with the appeal at the Supreme Court of Canada regarding segregation. As some of you will be aware, a number of us, including Deborah Parks and Adelina Iftene from two ends of one from Dalhousie, one from UBC, two law profs. We wrote a joint op-ed which basically talked about the fact that part of the reason I think that decision was made was because the Supreme Court of Canada was poised to look at the whole issue of not just segregation, but also imprisonment and the overrepresentation of certain groups in those areas. And we could have had an opportunity for the Supreme Court of Canada to weigh in at a time when almost everybody has been in segregation for the last 3 months, and really, lay bare what the Senate identified last year when we were considering Bill C-83, and that is the fact that that bill merely renamed segregation, and it essentially removed the current or the pre-existing oversight mechanisms, inadequate as they were, for segregation. And so we're now in a situation where all of this evidence is having to be rebuilt, and we have lawyers who for years have not fully understood what actually happens in prisons. Not because they don't want to, but they don't have access. And so one of the realities is we end up seeing some of the most progressive positions that have been taken in this area in the last few years have ironically been by the 30-some senators who have been going into prisons as part of our work to look at what's happening and to monitor what's been going on since the passage of Bill C-83. So those of you who are working in this area, those who are advocating, you pushing for us to, when we are able to reconvene, to finish the human rights study on the human rights of prisoners, I think will be vitally important, so that that kind of evidence will be available to all of you. But in the meantime, if there are areas that you need information, please don't hesitate to be in touch. And thank you again for inviting me. It's a humbling honor to be part of this gathering.
Thank you, Kim. It's amazing to see you and amazing to hear your intervention and your voice on this, and to remind us to be paying more attention. The next speaker is Juliette Nicolette, who is the Policy Director of Ontario Friendship or Federation of Indian Friendship Centers. She is, has been in that position for 13 years. Prior to that, she articled and then served as counsel for the Ministry of the Attorney General of Ontario. I have on note that she has her MA in political science from the University of Toronto, and she has been working in this area for considerable years. So thank you for joining us, Juliette, and I look forward to hearing what you have to say.
Thank you. Thanks everyone, and thanks for inviting me. I'm very happy to be here, and I've listened to the other panelists with great interest and appreciation. I've really enjoyed a lot of the presentations, so it's been fun. So my name is Juliette Nicolette. I'm the Policy Director at the Ontario Federation of Indigenous Friendship Centers. I need to update my bio. I've been there for about 15 years. In this role, I want to draw on some of the comments that people have made, because I think that some of the changes that I've seen in 15 years and some of the things that have remained consistent over 15 years and for much longer before that reference some of these discussions. And I might start by talking about what Senator Pate just mentioned, which is that COVID has exposed the lack of social safety net that exists in this country. And I think that while that is very, very true, the lack of safety net is actually at the origin of the existence of friendship centers that started 60 years ago, specifically to meet the needs of Indigenous people who were migrating for a variety of reasons. I won't get into the long history. Migrating for a variety of reasons to urban settings and seeking to make a life in the city. And the absence of, or the absence of social services, essentially, or the inaccessibility of social services as a result of racism and colonial attitudes, is at the root of the origin, is at the origin of the Friendship Center movement and friendship centers across this country. And friendship centers since then have spawned a large number of other kinds of organizations, housing, shelters, the health access centers, the list goes on and on and on. And so it's in the context of a long history of providing services that friendship centers in Ontario and probably elsewhere, but I won't speak for them, have been trying to meet the needs, and in large part succeeding, of communities through this COVID pandemic. One of the things that we have seen most glaringly, I think, across the 29 Friendship Center communities in Ontario, is that when the pandemic first, when the state of emergency was declared on March 16th, I believe, or 17th, what ended up happening is a lot of mainstream social service agencies simply shut down. And in this shutdown, no one was left to pay attention to Indigenous the Indigenous communities, and friendship centers, essentially through resiliency built through 50 plus years of providing services, stepped up to the plate. And in many communities, it has been an amplification of the historical and traditional role of friendship centers in serving communities that has taken place. And so I'm going to talk a little bit about sort of the different areas that this has happened in, and hoping not to be too siloed in my approach. It just is kind of a little bit simpler, understanding that all of these things intersect. So first of all, in Ontario, and nationally the statistics is also quite high, but in Ontario, just over 85% of Indigenous people live in urban, rural, and cities and towns and rural areas, which means there's a large proportion of the population that actually live in places where friendship centers are located and other urban Indigenous service providers. So 58% of the Indigenous population lives in a city or town with a friendship center. And in many cases, and certainly in the Northwest and the Northeast, the friendship center is either the only Indigenous service provider, maybe the only Indigenous service provider, and in some cases is the only social service provider in the community, and is relied on for a broad range of services. Friendship centers provide a broad range of services ranging from justice to health to education. And so it is the people in the community who receive these services and their families and friends who turn to friendship centers even more when the pandemic hit. And one of the very first impacts we saw across all friendship center communities was really around food security. Food security became virtually instantaneously a huge issue as people's access to income was greatly diminished and their isolation appeared overnight. And so getting access to food became one of the primary functions in the initial stages of friendship centers. And so this took place through across program areas. So we had friendship centers delivering food to seniors, to students registered in secondary school programs in schools, to anybody who needed it. Friendship centers in that time reported increases in food bank use. Some friendship centers had food banks, some did not. Those who did reported increases of 200 to 300%, moving from 100 families to 300 plus. Others reported increases from a fiscal perspective, so talked about spending up to $13,000 a week on food, having nowhere to store food and having to rent refrigerated trucks to store the food in their parking lots. So these are the kinds of things that we saw both from an organizational perspective, but also at a community level. In terms of the health impacts, beyond just food, very significantly, we have seen a great increase in terms of the impact on mental health. So isolation has had a real effect on isolated. We have programs that specifically serve seniors, many of whom are already isolated. And so the increased isolation and increased difficulty in accessing services through the programs provided by friendship centers was really felt widely. Youth also in particular have been and continue to be deeply affected by isolation and by having only, if they have access to technology, having access to socializing only through technological means. And while friendship centers have strived to, let's say, optimize or leverage the use of technology to continue to maintain contact, it's something that youth have felt very strongly. And a number of communities have reported increases in suicide and suicidal ideation and overall self-harm, and significant mental health challenges beyond that. So another area, and I'm conscious of time and I don't want to go too far over my 12 minutes. Another area where we have seen where there's been a huge impact, we have been unsurprised about this, levels of government have reported to be shocked, is in the impact and the effect and the increase in homelessness. So we have always known that in our communities, in friendship center communities, that hidden homelessness is a huge phenomenon, and that the numbers of homelessness that are accounted for by any number of different kinds of techniques, including point-in-time counts, did not misrepresent the actual true number of homeless people who are couch surfing, sleeping, at their aunt's house or between places, etc. And so the suddenness of the pandemic revealed this for all to see. When people got kicked out of places where they were staying because people needed to isolate and limit contact according to public health guidelines. and homeless people who might have been in shelters or might have been itinerant in some other way had nowhere left to go. And friendship centers have reported consistently that shelters are packed, they're full, and that people don't have anywhere to go. So in Ontario, one of the solutions has been to put people in hotels and motels. But this too has demonstrated itself to be of limited, there's a limited capacity. And so people continue to struggle in finding accommodation. And so so we have had conversations with a number of government actors who have said to us that they were actually surprised by how many people sort of came out of the woodwork was one of the phrases once used. And as I said, for us, this is not news, and we have been advocating very strongly and have had quite a bit of success advocating for friendship centers to deliver housing, and the friendship centers do deliver housing. But this is something that we would anticipate in a logical post-COVID recovery plan should really be one of the centerpieces of the government's, of all levels of government's attention in terms of what might have the greatest impact, not just economically, because we know that housing starts are a big economic driver even at the local level, but more specifically in terms of providing the kind of safety and stability that people need in the event of pandemics. And in the Indigenous community, having those kinds of investments would have much wider impacts, because they would address a severely entrenched problem that combines with a number of other issues such as domestic violence, poverty, etc., to really amplify the effects of homelessness. And Dr. Adams spoke about the social determinants of Indigenous health, and I think that those things are the way in which housing as a social determinants of health disproportionately affects Indigenous people here has been revealed. So not just revealed, but also I think the intersection between housing and homelessness and this pandemic has demonstrated the extent to which housing is also a health crisis. And so multiple levels of institutional failure over years, so over time and over jurisdictions, have led to the result that we now have. And really the only viable solution that we really see, and one that friendship centers are actively engaged in, is one that is, and the O5C also, that really drives home the need for a human rights and Indigenous rights based approach to self-determined housing, and by self-determined, Indigenous controlled, designed, developed, delivered, and evaluated. So that's in housing. I want to speak also a little bit about, I spoke a little bit about youth in terms of mental health. The friendship centers have a school, the alternative secondary school program in friendship centers is what it's called. And there are 11 of the 29 friendship centers in Ontario that have secondary school programs housed in the friendship centers, frequently in conjunction with childcare and any number of other sort of holistic wraparound supports that are provided. And those students, the friendship center there, the friendship centers that have the ASSPs, we call them ASSPs, the ASSPs have been an exemplary, a perfect example of how friendship center resilience in the face of crisis. We have reports from the schools and the coordinators of schools and the teachers that are participating that really all efforts have been made to regularly reach out, and not just reach out, but also reach students. We have coordinators printing out homework at the friendship center, working in social distancing and with PPE, etc., bringing packages of homework and foods and medicines to students who are isolated and who frequently are struggling in situations that are very, very tenuous. And so I'm kind of blending impacts and responses here, but that has been a really meaningful, and I think that's been a really meaningful effort by Friendship Centers that has not been seconded by the institutions and the ministry in particular that is supposed to be supporting these efforts. And in particular, when we laid out very clearly the needs for increased technology, et cetera, we continue to struggle with having the kind of responsiveness that we would need. Which isn't to say that there's a ton of responsiveness overall, but certainly because of the disproportionate impact on Indigenous students, we would anticipate a little bit higher level of engagement than we have been receiving. So Friendship Centers are doing the best they can in the context of education. And then somebody online, I saw in the Q&A, somebody asked about students and online learning. So I just actually want to take the opportunity to answer that question a little bit. The take home message about, at least in Friendship Centers in Ontario, about online learning is that it doesn't work. Students feel totally disengaged. They feel disconnected. It's simply not an approach that works. And the experience certainly of the alternative secondary schools would reinforce that in particular. And as I think it's unsurprising when you're talking about students who regardless are being marginalized in the education system, that would not be something that works particularly well for them. I just want to mention a little bit about justice. The Friendship Centers deliver two justice programs, the Court Work Program, which is a national program that's run across the country by various agencies, and the Community Justice Program, which is a smaller program that is that's run out of just a small number of Friendship Centers in Ontario. So, linking this a little bit to the gender impacts of COVID, we have had reports that 42% of court work sites have seen an increase in domestic violence issues, and that these have actually been related to some of the releases that took place in Ontario, because the releases in many cases took place without very, very quickly and without the provision of appropriate supports in a context where providing appropriate supports was admittedly very, very difficult to do in the first place. And I think that this speaks again to the fragility of mainstream institutions and mainstream systems, and the lack of engagement with Indigenous institutions and systems, regardless of where they are found. And a number of speakers actually spoke to that with respect to data and understanding where people are and where they're at when you find them. And I think that it's actually a bigger problem than simply we don't have the information. It's on some level that the system actually doesn't think that the information is important enough to warrant getting and to think through in terms of what is the impact on the ground. So the last thing I wanted to talk about, just really quickly, so I apologize for speeding through some of this stuff, was Courtney said something that I thought was really, really great. She said, and I had the good fortune to work with Courtney a while ago. She said that there's a right to care for one another, that Indigenous people have the right to care for one another. And I just wanted to underline that when looking at what have been Indigenous responses and what have been to COVID, one need not go very far to find the answer, and that really the right to care for one another is about the right to self-determination and the right to exercise your self-determination as you see fit, which is correct, it's self-determination. And Friendship Centers have been doing that for a really long time. I said that at the outset, but Friendship Centers have been doing that for 50 plus years, 60 plus in many provinces in this country, and are exercising that right to care for each other. And in so doing, demonstrate, I think, the resilience of Indigenous communities, and should logically then prompt decision makers to think about what might be some ethical approaches to engaging in reconciliation and engaging in conversations with Indigenous communities broadly across this country and certainly in Ontario. I will leave it at that, and I'm happy to take your questions. I will put my email on the chat, or yes, on the chat, and then if anybody wants to get in touch with me, I will answer you by email if you'd like. Thank you very much.
Thank you, Juliette. It's so amazing to hear of the extensive services and the provisions that Friendship Centers have been engaged in on Ontario and indeed across the country. And they provide such amazing services in terms of food security and responses in terms of food security, online education assistance for the kids. And it's a great reminder as to the resilience of communities. And when we talk about a right to care, I always want to just remind that we should maybe think about the responsibility to care, because in Nihil thought we have responsibilities to do things, not necessarily rights. They're innate responsibilities of us as humans. I want to turn now south of the border to Megan Hill, who is Program Director, Harvard Project on American Indian Economic Development, and the Director of Honoring Nations, also at Harvard. The Harvard, or the Honoring Nations program is at the Harvard Kennedy School in Governance. Through applied research and service, the Harvard Project aims to understand and foster the conditions under which sustained self-determination or self-determined social and economic development is achieved and sustained. The Harvard Project has been with us for a number of years, and I know we'll hear more about it from Megan. But I just want to acknowledge and say thank you to Megan for joining us. At the beginning of this, as the pandemic was announced, both Megan and I were supposed to hop on planes that day to meet up and to go over to Australia to be part of some treaty talks and some Indigenous women in leadership talks. So I want to just acknowledge Megan and thank her for joining us here online rather than in Australia or New Zealand as we typically see each other. So thank you, Megan. The floor is yours.
Sure, thank you. Make sure I'm unmuted. Hi, it's so nice to be joining you virtually. As Kira said, I'm Megan Manuka-Hill. I'm from the Oneida Nation of Wisconsin. And I am joining you today from the traditional homelands of the Massachusetts people. So thank you so much for including me in this important discussion. And I've really enjoyed the conversation so far. So I was asked to talk a little bit about the impacts of COVID-19 in Indian country in the US. And today I've heard a lot of echoes about what you're experiencing here in Canada with what we're experiencing in the US. And like anywhere, the impacts are really multifaceted and complex. And I think it fundamentally is reflecting the cracks or the weak points of many nations, including tribal nations. And so highlighting the systems where they're not working that maybe we've been band-aiding over or ignoring, and we simply can't ignore them anymore. And so I think more than ever, it's really critical for tribal nations to engage in nation building, exercising their self-determination, building and fortifying their institutions of government and governance in a way that's culturally aligned and sustainable, and critically sharing their strategies so that we can learn from each other and we can engage each other. There's no better time than right now. Just it's an incredible point in time that we're all sharing. Just as a little context, many of you probably know, but as background, 574 different tribal nations in the US. Much like Canada, they're incredibly diverse with different histories, different governmental structures, different sizes, both by population and geographies, different socioeconomic situations. And I think it's important to bear that in mind because COVID is not impacting Indian country in exactly the same way everywhere, though there are patterns that we can see. So what I'd like to do is just share a little bit of what we're seeing in terms of the health impacts and the economic impacts, and maybe a little bit about reopening now. So in terms of health overall, there's really no question that it's significantly impacting Indian country. The outbreaks mimic outbreaks anywhere in the world, with hotspots popping up due to super spreader events, whether people are gathering for social events or religious events. I think the key difference in Indian country is that we have a different starting place. Already we have economic issues, health issues, food security issues. So COVID-19 is adding stress to really an already stressed situation. We have some colleagues at UCLA and the University of Arizona that are releasing a paper in the Journal of Public Health Management and Practice. And what they found was the rate of COVID-19 on tribal lands is 4 times higher than the US as a whole. And I think somebody earlier mentioned the Navajo Nation. Mid-May, Navajo had the highest rates of COVID in the country, far surpassing New York State, which was at the time considered the pandemic epicenter of the US. Several reasons for this, most likely to occur in tribal communities with a higher proportion of homes lacking indoor plumbing. So access to water is the big issue, washing your hands. In places where there is housing overcrowding, so where multiple generations are under the same roof. In communities where maybe English isn't the predominant language, and that's really critical because you need to have information and messaging that's shared in culturally and linguistically relevant ways so people get the messages about social distancing, how to pick up prescriptions, where to get PPE, where to get tested. And of course, underlying all this are higher health disparities, and it speaks to really generations of systematic underfunding of public health systems, access to healthy traditional foods, lifestyles that have been shaped by colonialism, and I think it's been said before earlier today, institutional racism creates sicker populations. Tribal leadership has been extraordinary. Responses were really swift. Immediately, tribes issued stay-at-home orders. In fact, they were some of the first governments in the United States to do this. Travel restrictions, closed borders. I'm going to talk in a second about some of the impacts of the shuttered tribal businesses. But these are all efforts to keep citizens safe, and frankly, their neighboring non-native communities safe. Also, incredible grassroots responses. We just shared a number of women-led initiatives throughout Indian country, from mask making to storytelling to accessing and distributing food to building infrastructure through solar power. So it's really just been incredible. And what you're seeing is tribal nations and tribal communities and individuals really grounding into traditional values and teachings to care for elders and families. And you see this also with roadblocks. Access to PPE and testing remains critical, especially as we're in this phase of reopening. There seem to be stark disparities in accessing these resources. It is spotty across Indian country, though it does seem to be getting better in some areas. And you've probably heard the federal government really, and leadership has really been absent in these conversations. In terms of the economic impact, crisis is having a tremendously negative impact. And I think what people need to understand is since the 1970s in the US, we've been in this era of self-determination, where tribes have the same powers and responsibilities as any state or local government to meet the needs of their citizens. So, for example, they're responsible for paving roads, managing health departments, running schools, including the development of curriculum, to trash collection, sort of anything and everything you can think of that states and local governments do, tribal governments do. Yet, unlike states and local governments, there's tribes lack a traditional tax base, so like property taxes or sales taxes, those sorts of things, income taxes that typically fund government operations. And so instead, tribes really depend overwhelmingly on business enterprises. So gaming, casinos, but also non-gaming enterprises to fund these really key governmental activities. And so when the pandemic hit, there was this abrupt shutdown of tribal enterprises, including, I think there's 245 tribal casinos and other business enterprises. And so there was this immediate and shocking economic impact where there were massive furloughs and layoffs and really sort of devastating to both economies and governments. And I think it's also important to know that particularly in rural America, tribes tend to be the economic engines there. And so there's significant spillover impacts regionally beyond tribal lands to non-native neighboring jurisdictions. To give a little bit of scope to what this means, immediately before the pandemic struck, tribes were contributing aggregately $127 billion of GDP to the US economy. That correlated with 1.1 million jobs. What's interesting is 915,000 of those jobs, so 75 to 80% of those jobs, were held by non-natives. So you're seeing this really interesting regional spillover impact that's sort of working in tribes, but also sort of the regional tribes. And somebody had mentioned it earlier, sort of this rising tide. When tribal nations do well, the whole region does well. When tribal nations are hurting, the whole region also hurts. And so I think we're seeing this in real numbers. We are now in various phases of reopening. Some tribes, not all tribes, have opened, and it's certainly not at full capacity. Health implications are being monitored very, very closely. We spoke recently to the governor of the Gila River Indian community, Governor Lewis, and they've opened some of their businesses, and right now what they're doing is they're testing every single employee to contain the spread, both to keep tribal citizens safe, but also their patrons safe. And the Gila River Indian community is overlaps a major metropolitan area, the city of Phoenix. And so what they're seeing is that the cases that they're identifying and caring for are actually non-tribal citizens. And so they're really trying to contain the spread, both for their people, but also sort of the larger area. We're seeing also tribes who prior to opening had no cases. Now they're starting to see cases. And responding. Salish Kootenai in Montana has an intergovernmental unified command center now that is immediately sending out alerts. They're doing tracing, and they're really trying to sort of contain outbreaks when they happen. I had mentioned a little earlier about cracks, and I think what this particular pandemic really points to is the importance of preparedness. Preparedness so we can mobilize quickly, so that we can, we can strengthen our nations and use this as an opportunity to actually come out of this stronger. And so we're seeing tribal nations really starting to leverage different resources, whether it's CARES Act funding and other sources of resources to really build infrastructure. Sometimes some of them are building contingency funds or writing and strengthening their emergency management ordinances. Colville is put a lot of attention on expanding their broadband. We're seeing this also with food systems. So the Quapaw Nation in Oklahoma, they won an award in 2018 for their agricultural programs. They are the first tribal nation in the U.S. to have a USDA meat processing plant. They experienced no food shortages. And it's primarily because they were prepared and they have invested in their food systems in a really comprehensive, thoughtful way for many years. And I think it's important to take a lesson from that. What are we investing in? What's important? What do we need to shore up? We're seeing the Cherokee Nation, they're in early planning stages of an initiative called Respond, Recover, and Rebuild, where they're putting significant resources to restoring operations, but also assisting with ongoing responses to food distribution, to utilities, and also establishing a future epidemiological center. And so it's really about recovery and resilience, and I think emerging stronger. And at the Harvard Project, we tried to help in a couple of ways, one through research and one through providing practical tools. And so thus far we've released 3 policy briefs, really looking at the Disbursement of CARES Funds Act, which were $150 billion of relief funds to states, tribes, and cities. Tribes were allocated $8 billion of that. And so we've been trying to both support Indian country and educate Treasury. But we've also sort of, for folks on the ground, decision makers on the ground, added to our family of nation building toolboxes. And so we have a COVID-19 toolbox, which is interactive multimedia resources for tribal leaders and decision makers, where it's a platform where reciprocally tribes are sharing what they're doing. We've partnered with Johns Hopkins University Center for American Indian Health to marry public policy with health policy. We have tips of the day and videos, and it's one of the things that's happening is Google's actually making a docu-short about our work on the toolbox and highlighting one of the tribes that's both using the toolbox and contributing, and it comes from the Thanawatha Nation and their Govu district. And so sort of exciting, but what we're really trying to do is provide a platform for tribal nations to learn from each other, and not that sort of one thing that works in one tribe can be sort of wholly, taken and plopped down in another tribal nation, but that there are lessons from successes that can be teased out, adapted, and applied. And so it's sort of exciting to see that synergies between tribal nations happening, and I think I'm out of time, so I might just stop there.
Thank you, Megan. I could listen to you talk about what's going on for days, I'm sure, as could all of us, I'm sure. You remind, and I just want to draw a couple of attention, is that we can work through, and so many communities are working through, to come out of this stronger, and using this as a nation building opportunity or a rebuilding opportunity. And whether we think of that in terms of the friendship centers picking up and doing more in terms of food security and creating these extensive networks, or the Bear Clan Patrol here in Winnipeg. Halo River is, I spent much time there, and while I was living in Arizona for a term, and they're just doing so much in terms of living that relationship and realizing that doing something in the community is doing something for all, and living that relationship and rebuilding community. The wider community is a means of rebuilding the nation, because there's this interdependence now of the two because of so many people occupying territory. So thank you for bringing our attention to that. And the Thanawatha, their toolbox. And I think that all of us could maybe pay attention to what's happening with the relationship between Google and so many First Nations in the US on creating digital tools. And Thanawatha is one of those such examples. So I hope to see more discussion of this, and maybe in Q&A or in the future. We now turn to Damien Lee, who well, the last speaker is my former PhD student and a phenomenal young scholar who is describes himself as a cisgender, racially white man who was adopted as an infant into Fort William First Nation, and who belongs with and who sits with and is part of the Anishinaabe of the northern shore of Lake Superior. Dr. Lee's research focuses primarily on resurgence of legal and governance traditions, and often considers how such systems are impacted by and the pushback against settler colonial law and settler colonial society. So I'll hand the floor to you, Damien, and so good to see you as well.
Thank you. Thank you to everybody as well for the discussion today. It's nice to see some familiar faces and some familiar names in the participant list. I did my, as Kira mentioned, I did my PhD at University of Manitoba in Native Studies. So it's nice to have that connection back to Winnipeg at this time. I have a couple things to say before I get into my short talk. When Courtney Sky's video and audio cut off earlier, I did check with her, and she asked me to pass along one final point that she wanted to raise, so I'll just do that quickly. The last thing that she wanted to raise was that she wanted to emphasize the work of community. So she says that the work that she and others are doing isn't possible without communities making the connections with her, with scholars, and with other communities. So she would invite people to reach out to her on social media. And she also wanted to acknowledge the people who have shared and or leaked information at great personal risk in order to call attention to First Nation realities. And for those of you who don't know, such information can be shared confidentially through the Yellowhead Institute's Edward Snowden webpage or process. And I'm just now going to paste a link to that process in the chat so that people who don't know about this can look into it. I just wanted to say those words for Courtney, just because I think it was important that those thoughts be passed along to the group. And with that, I'll just move into my short talk. So I'm going to basically raise 2 or 3 research questions that may be of interest as we move through the remainder of this pandemic. Of course, starting in March, the time window is still brand new in many ways. And so the questions I'm going to speak to really address the issue around community borders, the way those borders are maintained or controlled or asserted. And really, I'm coming at this from a dual lens of centering community interests and exploring and centering First Nations jurisdiction or sovereignty or governance over their own lands and over their own futures. And so with that in mind, I'm basically going to move through a bit of a history first in terms of, so this is focusing specifically on First Nations in the Canadian context, and recognizing, as Dr. Sinclair mentioned at the beginning, there is a need to explore COVID responses in the urban context. This doesn't really do that. I'm really focusing on reserve context, but I do recognize the importance of Dr. Sinclair's call to action on that point. And so in beginning to talk about the assertion of these borders, the physical borders at the reserve boundary or territorial boundary, I think it's important to just give a little bit of history first in terms of the Canadian context, and then I'll move into some of the more specific things that community members have been discussing with me around the responses to COVID, and maybe even some of the opportunities that COVID is presenting to communities in a positive light, if I can say that. So with that in mind, I'll just turn to the history, and I should also say that nothing I'm going to say here is meant to be universal or prescriptive or totalizing. Obviously, all communities are going to have their own responses to COVID moving forward. So I present this from conversations I've had with Anishinaabe communities in Ontario. So looking at the history of how reserve access has been theorized and even enforced in Canadian context is actually, I mean, in terms of Canada's history, it's actually quite old. So, you know, if we think about trespass laws and the prohibition of non-Indigenous people, or I should say, in terms of Canadian legal history, non-Indians, in terms of non-Indians accessing reserve lands, the history is quite old. It goes all the way back to the Royal Proclamation of 1763. And looking at Jack Woodward's work around, you know, native law in his book Native Law, he speaks about how almost any non-Indian is actually not allowed to be on reserves unless there's permitting legislation. So, you know, historically, there was a time where there was a charge. I mean, actually, there still is a charge technically in law, but where these laws were enforced. I remember seeing signs in some First Nations when I was growing up of the trespass law signs saying, you know, do not enter unless you're ready to pay a fine. And so it's interesting just to plant that history now, because when we're looking at the way some communities in Canada are controlling their reserve boundaries, in Canadian legal sense, there is a deeper history that really speaks to this control of access. Of course, within Indigenous legal and political orders, there may be other aspects of those orders that mitigate and regulate access to land. Of course there is, but you know, just to raise these points, I'll move on, and you know, just basically trying to pique interest in this history. Moving forward to today, the Indian Act, so the federal piece of legislation in Canada, does still have trespass law. So Section 30 of the Indian Act speaks to the ways in which that those people who trespass onto reserve can be fined or imprisoned. So I'll just quote the text for you. So a person who trespasses on a reserve is guilty of an offense and liable on summary conviction to a fine not exceeding $50 or to imprisonment for a term not exceeding 1 month or both. And so I raise this just to point to the fact that, you know, this issue of access to land outside of COVID reality does have a history and does have a legislative kind of home. And, you know, it stems back all the way back to the King of England in terms of trying to protect Indians from molestation, etc. And so I raise that just to contextualize the fact that many First Nations in Canada are enacting, whether we want to call them blockades, checkpoints, roadblocks. I realize that some of those terms are heavy in terms of the history of First Nations civil disobedience, for example. But you know, the current actions do have a history. And so when we're looking at moving forward a little bit, when we're looking at the kind of nature of First Nation control over that access to reserve land, there's a certain kind of focus that many First Nations that already have pre-existing no trespass bylaws are trying to address. For the most part, they're really trying to address the safety of their communities and the personal safety of their band members or their citizens. And so, for example, some First Nations have enacted no trespass bylaws to protect their communities from the illicit drug trade. You know, other First Nations have enacted bylaws that don't necessarily specify what the negative behavior is that they're trying to target, but they nonetheless have no trespass bylaws that really do speak to this focus of protecting community health, or the community itself. And that really does ring true now that we're looking at COVID. With when we look at the checkpoints or blockades that are happening with in response to COVID-19, it really is, again, in most cases, because I recognize what Dr. Adams was saying, is that there could be a political spin here sometimes, but really it's couched again in that ethic of protecting health. And so it's important just to think about that and as an aside, when I was kind of preparing for this talk, I noticed something interesting. I'll just share with you quickly, that the First Nations that are enacting bylaws and are posting them online, they're rooting them in different political and legal sources. So some are rooting them in treaties, some are rooting them in inherent rights, some are rooting them in the Indian Act itself. And I would say, not that I've seen in the published bylaws, but I would say that there is likely discussion happening out there about rooting land control, etc., into their inherent political systems as well. So these are different sources of law that I think, we don't have time to get into today, but they are important to put on the table, because we always have to remember that the Indian Act and federal legislation is not the only game in town when it comes to First Nation or Indigenous political authority in Canada. So just moving, in the few minutes I have left here, I just want to share with you some of the questions and some of the insights that are emerging. And I stress the emerging point here because it's too early to really say for sure what's happening. But things are emerging here, and I just want to share them to maybe pique some interest around future research conversations. So right now it's unclear to me the total number of First Nations in Canada that have enacted some sort of blockade or some sort of checkpoint. Maybe people know about that. If that's the case, I would love to see that information. But right now, I would like to know what is the not only the number of those communities that have enacted these actions since early March till now, but also what is the flavor and what is the kind of nature of those actions. For example, are these kind of blockades or checkpoints porous in the sense that maybe there's economic activity that's being permitted while personal kind of visiting and that kind of thing is being restricted, or is it a flat out no access? And I think analytically, the next question for me would become, well, what does that tell us about First Nations goals and aspirations in terms of how they're seeking to protect themselves in this moment? I don't have the answer to that. And again, I'd love to hear some feedback if people have that information available. But also through my ongoing conversations with people at community level who are participating or thinking through COVID-based checkpoint responses, there are some interesting things coming up. So I already mentioned the illicit drug trade in terms of how pre-existing no trespass laws kind of often can speak to that. Some people are talking about that now as well in terms of one of the kind of spin-off benefits of communities that do close down more fully is that they're wondering and they're hoping that the illicit drug trade may be impacted by this. Obviously, drugs can find their ways into systems in various ways, or in communities in various ways, but that's a question I think is useful to raise. And an additional question speaks to the way that, or the potential way that these checkpoint-based responses may be reducing incidences of sexualized violence on reserves. So, for example, Indigenous women in Canada and in the United States have been speaking to this concern about man camps for quite some time. In a Canadian context, it's definitely back since the 1970s, maybe earlier, but we have evidence of Indigenous women speaking about man camps and raising this issue as an issue of concern for the ways that it impacts in sexualized violence in First Nations communities. And so some people are raising the possibility of, do these checkpoints and reserve-based lockdowns have any impact on reducing the incidence of sexually based violence in instances where a First Nation may be next to a man camp? I think this is a useful thing to raise because it does shed light onto this ongoing issue of man camps, and it may speak to it may provide some data or some knowledge in terms of how control over land and control over reserve boundaries really may or may not contribute to ameliorating that issue. So my timer has gone off. I'm going to kind of just wrap this up here. But I'll just end on a reflection. So as the pandemic was really starting to unfold and things were starting to lock down, I was really conscious of the way that non-Indigenous communities were reacting to First Nation lockdowns or checkpoints. And, you know, I noticed it just anecdotally, I noticed that in some cases where communities announced a lockdown or an impending lockdown, non-native communities next to some reserves may, in some cases, did really kind of conjure this anxiety in some ways around First Nations controlling land in certain ways. So with the early kind of like the early closures of communities, there were examples on social media, not necessarily mainstream media, of non-native folks expressing racialized and eliminatory kind of sentiments towards First Nations, saying like, oh, if they're just going to lock down, then we should just, they should be kept on the reserve, that whole sentiment. And we've seen that before, especially in times of crisis, where First Nations express emergencies. That sentiment can arise. And so it's interesting to me, just in the sense of to see that again with COVID, because I would reflect, again, this is just, a thought and process. I would like to understand more the function of that anxiety in terms of how the non-native society in Canada interprets First Nation jurisdiction over land. We see other examples of, say, where land claims are in discussion or resolved. There's an anxiety within non-native society at times that is raised over this concern of First Nation control over land or use of land. And so it happened again with COVID-19 in certain examples. And so I just raised that as a reflection, because it speaks again to this aspect of jurisdiction and self-determination within Indigenous territories. So I've gone over my time. I'll just leave it there. Happy to discuss or answer questions moving forward. But with that, I'll turn it back to Kira.
Thank you, Damien. It was great to hear you speak and to really focus in on and reflect previous comments about how this really is also being used as an opportunity to address longstanding social issues, whether that be, and we need to take rise and to take action of what is happening in prisons amongst our relatives in those institutions, or whether we take rise and to deal with longstanding issues in terms of dealing with sexualized violence in man camps, or dealing with drug trades and drug trafficking in communities. So thank you again, Damien, and thank you for the panel. I don't see any questions and answers that haven't that are open and outstanding. I would urge people to reach out to panelists that you see online for if you have any outstanding questions. I just want to take the opportunity before I hand the floor over to Niigaan to thank everyone that presented. It has been, we put this together in about 2 weeks, and it has just been amazing to see the response. You've given us much to think about, and you're also showing that there is much left to do, and that we need to continue to look at data, to think about how we move forward. But for those of us that are on the research side, to continue to look at new ways to think about how we manage through this. For those of us that are in community, to really push new ways of thinking through these policy issues and responding to them. And always, of course, moving forward that trajectory of how do we continue to rebuild nations on and off reserve and on and off traditional territories. Diane Red Sky, I just saw a comment come up, and I will take that time to just say thank you, because it has been an amazing session. And thanks to everyone. And with that, I turn it over to Nigan. Thank you.
So miigwech to Kira, Dr. Ladner, for this great work in organizing. Miigwech to all the organizers and the panelists for spending time out of your busy schedule to come and share with us, and also particularly those who are doing the frontline work necessary. So I want to recognize all of our healthcare providers. I also want to recognize all of our aunties and our uncles and our grandmothers and our grandfathers who are not only doing the work today, but have always done the work to protect us and to support us in our lives as Indigenous peoples and communities. And I also want to say huge miigwech to those who came in and also participated, Minister Miller in particular, and then also all of the other questions and commentators. And if you've been here up to this point, you know that there are many people that we've mentioned throughout the various panels to be able to do this work as well. This is not the only session that's coming forth to do the next panel that will be with the COVID-19 Alliance will be Understanding Systemic Racism in Canada, Concept and Data, which will be on June 23rd. And information is available on the ACS website. So June 23rd, which is this coming Tuesday. So check that out. It should be fantastic and great. And in the chat throughout the conversation, you'll see many of the links. So for example, Dr. Lee mentioned the Edward Snowden website, which people can disclose and provide information. And there is a link there too as well for the next conference on systemic racism in Canada. And so huge miigwech to everybody. As you can see, we've spent a full 2 hours, and so we're going to sign off now. The recording will be available very shortly once it's processed via the Zoom app, and I think it'll also be available online, of course. And so check it out. And if there's anything further, you can send an email to the organizers of ACS. And I say huge miigwech. Thank you very much for your time today, and we will see you soon into the future. Miigwech. Giga Wabman Minawa.